Okay, you're ready to go.
Okay. All right. Meeting call to order at 10:01. So let's start with roll call.
All right, so voting members, do we have anyone for Barb Kirkmeyer representing CCI, otherwise Mike Wallace or Marie Madrigal?
Mike Wallace is on the line.
Thank you, Mike. Brandy DeLange for CML? Nothing heard. Cheryl Garcia? Nothing heard. Tim Kunkelman?
I am here.
Thank you, Tim. Mary Jane Rasher for Entrado?
Yes, I'm here. Thank you.
And I see Brandy just joined us, so I'll go ahead and check her off. Wes Horn? Wes Horn for CenturyLink? Not hearing anything.
Yes, I'm here.
Oh, you're here. Okay, thank you. Darla Joseph? Not hearing anything. Jared Hilson. I'm sorry. I'm gonna butcher your name every time. Hilsendegger. Jared. Okay, I'm not hearing anything. Monica Aiken.
Yes, I'm here.
Thank you, Monica. Ray Paddock.
Yep, I'm here.
Thank you, Ray. Lindsay. Okay, that's alternate for Ray. Other CLEC VoIP position: Jay Slater, Aaron Harris, or Erica Stevens.
This is Jay Slater. I'm here.
Thank you. Daniel Calderon or Suzanne Myers for Durango. Daniel or Suzanne? Nothing heard. Danette Martin.
On the phone.
Thank you, Danette. Jeremy Duncan.
Here.
Nice. I saw Jennifer Kirkland as well. Kimberly Culp, Val Turner, or Tracy Oldmeyer.
This is Kimberly. I'm on the line.
Thank you, Kimberly. Jackie Reynolds or Amy Book.
Good morning. We're both here.
Thank you. Beth Dobransky.
Looks like Daniel's here for Durango on chat.
Okay, great. Thank you. Beth Dobransky. Nothing heard.
She checked in on the chat too, Daryl.
Okay, great. I appreciate you looking at that because I can't look in both places at once.
Sure, sure.
Bruce Romero, Paul.
I'm here.
Thank you, Bruce. Valicia Librand.
I'm here on the phone.
Thank you. Jeff Irvin, I heard already. Connie Johnson.
On the phone.
Thank you, Connie. Deanie Shin or Shannon Bren.
I'm here. Deanie.
Thank you, Deanie. Athena Butler or Shelly Lesnansky.
I'm here.
Thank you. Have you been able to catch up on your sleep since Tuesday yet? I know Vicky Pickett's here. Scott Newman.
Sorry, Daryl, I couldn't find the mute button. I am here, but unfortunately I have to leave early, but I know Tina is here as well.
Okay. Do you want Tina to be your proxy on the task force going forward?
Yes, sir, please do.
Thank you.
She is much more knowledgeable than me anyway.
I don't think so.
You're both great. We'll just put it that way. Sean Shear or Brandy Seaton.
Sean Shear's here.
Andy Tolsheimer, I see on there.
Yep, I'm here.
Carl Stevens.
Here.
Thank you. And Patty West. Ted McEldown.
I'm here, Daryl.
Thank you, Patty. Ooh, we got good response today. We've got 90% in attendance of the voting members. Oh, and
Cheryl said hi, Daryl.
That off. Thank you, Cheryl.
Daryl, did you get me? This is Brandy DeLange with CML.
I did. Thank you.
Okay. Thank you.
I saw you check in after I called your name.
Thank you.
All right, so now I'm going to go through, just so we have a complete record, I'm going to go through the names that are showing up on the webcast, and then there are a number of people who are signed in just by phone. So I'm going to read your name, and if I don't read your name, but you're on, then tell me if you're on. So a few of these we've already heard from: Athena Butler, Amy Book, Annette Stolba, Arapahoe 911 Authority, which I'm assuming is Bruce, Beth Dobransky, Bill Levis, Brandy Delange, Brett Bonomo, Carl Stevens, Chris Lyman, Connie Johnson, Danette Martin, Daniel Calderon, Daryl Pratt, Deanie Shin, Director of Freecom 911, which would be Bill Duggins, or Bill Duggan, I'm sorry if I got that wrong. Ed Mills, Monica Million, Glenn Claich, Greg Brooks, Holly Bice, Jackie Louise, Jason Nettles, Jay Slater, Jeff Tucker, Jeffrey Irvin, Jennifer Kirkland, Jennifer Schwartz, Jeremy Duncan, Jerry Delval, or Delvalle, I'm sorry if I mispronounced that, Joseph Benkert, Julia Beams, Katie Haar, Ken Winward, Kimberly Culp, Lincoln County, which I'm assuming is Ken Stroud. If that's wrong, let me know. Mandy Stolsteimer, Matt Gage, Mike Cook, Mike Lyons, Mike Wallace, Pamela Monsees, and we did get Mike Wallace on there, okay. Patty West, Ray Paddock, Ron Lovin, Sadie Martinez, Sarah Rollins, Scott Newman, Shannon Brand, Sean Shear, Shauna Clementi, Shelley Gunther, Stacey Stacen Gross, Tim Kunkelman, Tina Bonetta, Todd Holsworth, excuse me, Todd Holsworth, Felicia Searle. Is Librand no longer? Is it Searle your current last name, or is it Librand? If it's Searle, I'll correct that on the.
No, it's Librand. Searle is my maiden name.
Okay, so I'll keep it Librand on the roster. Vicky Pickett, West Horn. Now, anybody whose name I did not read, who is on?
Jeff Davis on the phone.
Thank you, Jeff Davis.
Daryl, this is Holly.
Yeah.
I just want to be a little cognizant that we probably have interpreters on this call interpreting, and just for the sake of name calling and stuff like that. You probably
Sure.
just gave them all a heart attack.
Sure. How fast can you spell? Anyone whose name I didn't call? I realize a lot of these phone numbers are probably people who are also dialed in on the web.
Daryl, this is Suzanne Myers. I'm also here.
I'm sorry, what was that name?
Suzanne Myers.
Thank you, Suzanne.
Daryl P. Kirchhoff with CTA.
Hi, Pete Kirchhoff. I've turned on automatic closed captioning just in case it's needed by somebody. Unfortunately, it doesn't work that well. It butchers names worse than I do. Anyone else? Okay, Vicky, I'm going to call that good. And I'm going to ask if anybody didn't call their name out, if they would just send me an email, let me know that they were on the call so I can make sure it gets logged.
Okay.
Daryl, this is Cheryl.
Hi, Cheryl.
She's asking if Jared from Verizon is participating.
He did not respond that he was on today. He is filling one of the wireless positions, but I'm not showing him in attendance.
Okay, thank you. We have to drop off at noon.
Thank you, Cheryl.
Drop off the call.
Thank you.
Okay. Mm-hmm.
So, Vicky, I think we're good to move on to the next item.
Oh, okay. Somebody must have muted me because I wasn't muted.
Oh.
Okay, so up next I show approval of the minutes. everybody get a chance to review the minutes from the, like the last public meeting there was in March of 2020? Did anybody have any corrections, updates, additions, or anything they needed to add? Okay, hearing none. Can I get a motion to approve the minutes from March 2020?
So this is Ray,
Cheryl said I move.
and I'll second. This is Ray.
Okay, Cheryl first and Ray second. All in favor? I don't know. Do we do this on verbally or on maybe?
What I think typically works best is if you just do it opposite and say if anybody or
Anybody opposed?
anybody's opposed, and that way
That's
if nobody answers, you know it passes.
I like it. Okay. So anybody oppose approval of the minutes? Okay. Motion passes. All right. Up next, we've got the PUC staff update. Daryl.
Let me pull up our standing reports document. So the map that's showing on the screen right now is the map of updates for 911 authority profiles and PSAP profiles. We did great this year. I think using the map helped encourage people to get their profiles updated. So you can see there were a few 911 authorities that still didn't. We had a couple of PSAPs that didn't, but we got a lot closer to 100%. And I see Athena saying she has to jump off the call about 11:20. So after my staff update, I'm going to ask that we go to the legislative update so they can get that done before they have to leave.
Okay.
Where was I? Oh, so I've completed the report for the National 911 Program Office. They do an annual data collection, and I've started working on the one for the Federal Communications Commission. It's due in July, but I'm going to try to get it done early so that the governor's office has plenty of time to review it. And these profile updates that I ask everyone to do annually are critical to the success of those reports. So I appreciate people filling those out. 911 grant update. As of the writing of this, a few PSAPs had received initial invoices. There were some problems with those initial invoices, but CenturyLink has worked with us on correcting those invoices and getting, not necessarily correcting them, but improving the transparency of those invoices and getting them to the public safety answering points. And I'm happy to say that as of today, we have now provided initial payments to 2 of the 911 authorities for their grant migration. Those initial payments are the 40% matching payments. And then as soon as they pay those invoices and get us the forms that the state requires for proof of payment, then we'll be able to get them the remaining 60% from the federal portion of the grant. So grant payments have finally started after all these months. So I'm happy to report on that. Does anybody have any questions on the grant or anything else before I move on to the next item? And that's probably a topic that a lot of people have questions about or may have questions about. All right, I'm not hearing anything. PUC proceedings, the only proceeding really beyond 911 surcharge applications that we've got going on right now is the 911 reliability proceeding. We've kind of put that on hold pending the initial migration of some of the 911 centers because it's a lot of the same people involved in both the 911 reliability proceeding as well as the ESINet migration, as well as the fact that the ESINet migration is going to have an effect on 911 reliability. I will be likely scheduling a meeting of that group in either later this month or in June. However, so if you are part of that 911 reliability workshop group, be watching for that because we do want to keep track of what is changing in terms of 911 reliability as part of the migration. And I see Bruce says he votes for June. I'll make a note of that, Bruce, because we obviously need everybody to be able to participate without having to feel like it's like it's tearing them in multiple directions. So thank you for that input. FCC proceedings on April 29th, the commission filed comments, and there's a link in the standing reports document to those comments. You can see what those are. Those comments were in reply to a further notice of proposed rulemaking, or FNPRM, if you like following along with FCC acronyms, that was issued on April 28th. No, it was issued on February 28th. Let me correct that. Proposing to provide state agencies access to the National Outage Reporting System and the Disaster Information Reporting System. Reply comments are due on June 1st of 2020. So if you want to file comments, it's not too late. You just have to file them as reply comments. So I would encourage you to take a look at that. In the meantime, the FCC has issued a separate request for comment on, and there's a link here to that request for comment on a proposal to change some of the required fields in the National Outage Reporting System reports, as well as the 911 Reliability Certification reports. Those comments will be due 30 days after publication in the Federal Register, and to my knowledge, they haven't been published in the Federal Register yet, so that reply comment deadline hasn't been set yet, unless somebody knows differently. Specifically, one of the things that they're suggesting that they add to the National Outage Reporting System is that requiring the carriers to let the FCC know specifically which 911 centers are affected by an outage, whereas right now they only have to provide a geographic region that's affected. And if we do get access to the National Outage Reporting System as a state, I think knowing which 911 centers are specifically affected would be very helpful to us. So it'll be a matter of whether the benefit of that outweighs the cost of changing the system or changing the processes that the carriers use to respond to the National Outage Reporting System outweigh whether the benefits outweigh the costs, I should say. And that'll be up to the FCC to decide. In terms of federal legislation, there's a whole list of bills on the Colorado 911 Resource Center's legislation page that have been tracked for a long time. As everyone knows, Congress hasn't been moving a whole lot lately. We do have a new bill on the list right now, which is the First Responders Act of 2020. That's House Bill 5928. And as of the time I wrote this, it had gone through subcommittee hearings on February 27th. It's been a few weeks since I wrote this, so it might have changed since then, but to my knowledge, that's where it is right now. The Resilient Networks Act has been updated March 10th. It was forwarded to the by the subcommittee to the full committee by voice vote. And House Bill 3836, which is the Wireless Infrastructure Resiliency During Emergencies and Disasters Act, or WIRED Act. They always work very hard to get an acronym in there. It did go through subcommittee hearings on February 27th. And I know Monica's on the call, and as part of her duties for NENA, she's been tracking a lot of these items at the federal level. So I'm going to ask Monica if she has anything to add to the federal legislation report.
Thank you, Daryl. The 911 Saves Act. NENA continues to push that effort. Our government affairs director meets regularly with our folks in Washington. The bigger push right now, although that is near and dear to our heart, is the federal funding, the NG911 grant program that Senators Klobuchar and Nelson sponsored. The hardest work that's being done right now is to try to get that grant program folded into whatever the Democrats and folks are trying to fold into a proposed infrastructure bill. As of right now, we've been told that the grant program for NG911 has been folded in, but initially we were told that legislation was going to be introduced at the end of April, the 1st of May, but it has yet to have been introduced. I think as we're all watching this unfold, Congress is haggling amongst themselves again, so it'll be interesting. But I don't want anybody to think that we're still not pushing forward the reclassification effort. It's still up there. The more pressing issue is the funding piece, because we're all quite frankly aware that if we cannot get it introduced into legislation this session, most likely due to the economic impact of the pandemic, there will be little to no funding bills in the next couple of years. So we are really pushing forward that effort at this time.
Thank you, Monica. Something else I wanted to point out is that there was a bill, and it's still being tracked. It's the 911 Fee Integrity Act, which would direct the FCC to promulgate rules within 6 months designating acceptable uses of 911 fees by any state or taxing jurisdiction. I'm not entirely sure how that fits in with the 10th Amendment and the ability for states to write their own laws, but it would potentially dictate what 911 funds could be spent on at the state level, at state or local level, through the FCC rules. That act has not moved since April of 2019. However, the contents of that bill have been incorporated into the First Responder Act of 2020. So this bill is probably not going to do anything. The House Bill 2165, but if House Bill 5928 passes, it also includes the requirement that the FCC promulgate rules within 6 months designating acceptable uses of 911 fees. So we'll definitely want to be watching that. The FCC, if it does pass, the FCC will be directed to actually pull together a group of subject matter experts from, including individuals from the states, to put together those rules. And I'm sure there will be court challenges to it as well because of that 10th Amendment issue that I mentioned earlier. Does anybody have any questions or comments on that?
Yeah, this is Bruce. I was curious, based on that taxing authority or taxing jurisdiction statement, since we don't spend it at the state level with taxing jurisdiction, does that put our fees in danger of becoming taxes?
You know, I don't think so, simply because what's a tax and what's a fee is defined at the state level, but then it's difficult to say, because if the FCC is calling it a tax, then that does give potentially some argument to others who want to say that 911 fees are actually taxes. So yeah, I think it does create.
Yeah, that's my concern.
I think from the, I haven't read it, but from the federal, their issue would just be fees, surcharges, taxes, whatever you call them. Their concern is with diversion and use for improper purposes. So I don't know that they would really care what they're called. It's more that they're being used for 911 purposes.
Yeah, Joe, I agree with that. I think the danger, though, is if they call them taxes, even if they're not really concerned about what they're called. If they call them taxes, it might give some ammunition to people at the state or local level who want to call them taxes as well. But I think the more immediate concern is if they come up with a list of designated acceptable uses and they don't match what we have in our state statutes, what takes precedent? And I think that's where, you know, we might end up with some court cases, because I know that every state has a different list of acceptable uses of 911 surcharge fees. And that is all I had for the PUC update, unless anybody has any questions for me.
Any questions for Daryl? Okay. So Daryl, when were we moving? Were we moving the legislative committee up next then?
Yeah, I think we should, just in case, because I know Athena said that she had to get off soon, or well, at 11:20, so we've got time. But if it's all right with you, I think I'd like to move that up.
Sure. And I have one other change that I want to make too. It sounds like the doc that was ready to make a presentation at 11 is ready in at any time. So
okay,
tell them we can up a little bit as well. So.
Okay. Jackie and Athena, do I know you provided a written response for the standing report, so that's in the meeting folder for today, but do you have a verbal report that you want to give?
This is Jackie, and Athena, I'll let you jump in a minute too. Basically, I just wanted to update people. We are still moving forward with this bill. Representative McCluskey has tagged this as being an essential bill. We worked in the months, whatever months they were. I feel like I'm in the twilight zone. Anyway, whatever, we worked with Representative McCluskey putting together documents that we also have if anyone wants them. But we put together some documents to prove this was an essential bill. And so we are moving forward with that. Legislative, the General Assembly will be brought back May 26th, I guess, because the 25th was Memorial Day. And Representative McCluskey has assured me that this is the only bill she's really going to try to push forward and through. So we will, Athena and I will be moving forward next week with getting some meetings together with CCUA, the CML, and all those other acronyms, CCI, exactly. Anyway, all those other acronyms, we will be putting some meetings together to put some strategy together so that we're ready to go that week that session starts back up. The important part, I think, that we have for authorities is we would like to put together in the next few days, actually, and over the next few days and weeks, some answers to some questions that Athena and I came up with that we think are important. Let me pull those questions up real quick. The questions we'd like the authorities to be able to tackle are, so that we can put a document together, what are the budget implications currently in 2020? What are your potential implications for 2021? And have you been impacted the ability to hire, and are you having to cut personnel? And also, what projects are you having to put on hold due to the pandemic? As we know, our financial picture has changed greatly, and we're really, really encouraged and hopeful that this bill will go through, which will help us all, I believe, a little bit financially. And Athena, from that, I'm going to turn it over to you.
Okay. And I appreciate that. So I think it's really important. One of the reasons that we really need the information from these questions, if you're able to provide it, so that we can give it to our sponsors so they really can push, because all of us are going to have an impact with this increased bill that we're going to have, no matter where you are, if it starts this year or next year, it's increased cost. But in addition to that, we are, I'm reaching out to the representatives for Senate Bill 26. That is the one where 911 has been added to the PTSD bill. We were partially through getting that bill moved forward. It only required a second and third reading. But because there may be some minimal financial impact, we need to push again to make sure this remains a priority. I'll be trying to reach out to Representative Singer today. He was the big pusher on that. All of them were. To see if I want to make sure that we can keep this on their priority list, but we need you all's help to do that. As Jackie said, we'll reach out to all of the acronym groups, the different chiefs groups and that alike, to continue to get their support. But we also need to get support from you all to go to them so that this stays as one of their bills for a priority, especially with the epidemic that we're going through right now and how our employees, based on what's happening maybe within their household and all, are affected by this COVID. Mentally, that really impacts some of our employees. So we want to keep this bill moving forward, and we need your support to do that.
We have a comment from Brandy DeLange on the chat that says, I know you mentioned coordinating with CML on the surcharge bill, but I really ask that you call me sooner than that. The 3 weeks going back will be very tough.
Yes, and I just commented as well that I'll try to get that together this afternoon and put out some meeting times and dates. We could do some virtual meetings.
And Jackie and Athena, this is Monica. Just to let the audience know, once they finalize those questions, I'll be sending them out to the entire listserv so that we can get your response. And those of you who I'll be tracking your responses so that I can follow up in a phone call to determine whether or not you can provide a response to our committee chairs. This is probably one of the most critical pieces of legislation we've ever pushed forward, not to discount Athena's point on Senate Bill 26 with Representative Singer. But I too have been reached out to by the Senate bill folks asking if we were going to push forward. I'll be talking about that with our board at the Resource Center meeting, but we are a highlighted point of attention, and we need to push forward. So we'll be providing you guys with the tools to follow up with your elected officials if you so need to. Sorry, guys.
That's okay. Thanks, Monica. This is Jackie. And yes, Monica, if you want to get those questions out on the listserv, that'd be great. They're finalized and ready to go for people to answer.
Good.
The other thing I do want to mention is while Senate Bill 26 was further along than our House bill, the House bill did go through the Finance Committee and was approved at Finance Committee. It was then scheduled before everything shut down. It was then scheduled to go to appropriations. I'm not sure what it needs to happen right now, because we did put in amendments that make clear that there will be no state monies that need to be taken from the state general fund, that all the monies that the state needs will go through the surcharge collected, i.e. the prepaid, with Dora needing to make computer software upgrades. That amendment has been put forward that money come from the prepaid surcharges, and the money that PUC would need for staffing, that money would come from the supplemental surcharge. So I believe it still needs to go through appropriations, but it doesn't have a fiscal impact on the state. And that amendment has been put forward.
And just so everyone knows, the amount that the PUC would be able to retain would be capped at 4%, would actually be less than that, but it would be capped at 4%. And the amount that DOR has estimated that they would need to update their computer system was something around $12,000. So it's a very minimal amount out of the couple million that it collects from prepaid every year.
Thank you for the clarification.
And just so everyone knows, as a state employee, and the governor's office has not taken an official position on this, I have to remain neutral. But I will say that if this bill does not pass, something else will need to be done, because between the increase in the tariff cost for basic emergency service and the loss of sales tax revenue because of coronavirus, there is now a very, very serious financial challenge ahead, especially for the rural areas of the state. So, that's as much as I can say on the matter, other than, something needs to be done, whether it's this bill or something else.
Most definitely. Okay, so Athena or Jackie, do you have anything else?
Not unless there's any questions.
Yeah, and I'll just say one more thing. One of the reasons that we're asking again about those budget impacts, and I can use Denver as an example, is to really show, even though everyone is in a fiscal crisis, what that means specifically to 911. So as a city, when we're having to take 7.5% reductions for the rest of 2020, what does that mean in terms of services of 911 delivery within the city and county of Denver? So I'm being open about that because it's nothing that's hidden, but we are all facing that fiscal crisis. And so that's why this bill is so important, and any information that you can share with us so that we can provide it to our sponsors will be really helpful.
Okay. Well, thanks guys. Okay, up next we've got the BESP report. Cynthia Link.
I see that you've got the contingency plan on later. Do you want me to wait till then? Talk about that. That was really the only thing I had. We've been working on the user group stuff and got a few things that CenturyLink's working on, and that Shadow's working on. But the only thing that I was going to talk about was the contingency plan.
This is Daryl. Yeah, why don't we wait until later, unless Vicky would like you to go now, simply because I think Vicky wants to get the presentation on earlier from our coronavirus.
Yeah. Yeah, if that's okay with you, Tim.
Sure. So a couple weeks ago, we filed the latest contingency plan with the PUC, and after getting some information from you all from a few different sources, and a couple of things that I wanted to highlight, and I don't have any specific things, so I mean, I can get some experts on, so I'm not the expert here, but we did try to make some modifications to the plan to at least highlight what was an E911 legacy
So Tim,
portion. Yes.
I think we got our wires crossed. Are you okay with waiting until the?
Oh, I'm sorry. Oh no, I'm sorry. I thought you meant go. Yeah. No, I'm fine. Whatever you guys want.
Okay, thank you.
Appreciate that. Okay, then the other ESP report. And Trado, you have anything, Mary Jane?
I don't have anything today, Vicki. Thank you.
Okay, thanks. Agenda committee? Is that you, Daryl?
Yeah, let me go back. Where is it? Okay. Standard report on this one. There's a link in the standing reports document to the agenda committee page, which has a list of potential speakers and topics on it. If you have any suggestions for other speakers or topics, please let me know. That's it.
Okay, great. Bylaws committee, Kimberly, you have anything?
I do. So we actually met. We had some work to do. And so this is actually going to need a vote, Vicki, if for the voting members. So we have a couple of changes we would like to recommend for the bylaws committee. And if we need to pull up the bylaws, I'm sure Daryl could probably present those too, but here are the updates. Oh, actually, can you go back to the highlights? Sorry, not quite yet.
There you go.
Yeah, thank you. So we have a section where we talk through the voting members, and there is, our bylaws call for 17 seats for the PSAP and authorities, but we currently have 18. So we discussed how that happened and how we grew to 18. And so our recommendation would be that we drop that back down to 17, and we would just do that by attrition at the end of the year. So to keep it consistent with what we have listed in the bylaws on how many seats we would want for the PSAPs and authorities. We're recommending that we add one new seat, and that seat would be listed as a community at large. And we would give preference to an accessibility seat to try and fill that seat to make sure that we are representing accessibility issues adequately. So to have some backup in that area, an additional seat there. So those are the voting pieces changed. The task force, we have in the general section 29 voting members, so that would go to 29. And the vacancies caused by reason of expiration of the terms officers' terms be filled at January regular meeting. Right now we have it listed in November, so that would need to be changed to January. And that the newly elected officer shall begin after the elections, which occur at the January regular meeting. So bringing the language here in that section 6.1 aligned with what we do as a normal business practice. So not a lot of changes, but a few that the bylaws committee worked through that we would like the voting membership to review and consider approving.
Okay, and we're looking for an approval today, correct?
That's correct.
Okay. Can I get a motion to approve the changes as submitted from the bylaws committee?
Cheryl says yes.
Okay, I've got a motion from Cheryl, second.
Athena.
Athena, thank you. That's a second. Any discussion on this?
Cheryl has a comment.
Go ahead.
You know what? I didn't quite get that. Just one moment. Repeat that, Cheryl. Cheryl is typing. She's typing, I am pushing for that, what? I am pushing for that community at large.
Position. Okay.
Yes. Because I'm not deaf. And I cannot assume anything is no. How people the people who are deaf I talk to a lot of people who are deaf and their their culture, that was the word, their culture is one I don't understand. I'm sorry. I'm what's that word? Trying to understand. So that's why you want to push that community at large position. Okay, that's what she's saying.
Okay.
Right, thank you.
I appreciate that.
Is that it? Okay, go ahead.
Okay. Anyone else have any discussion, questions, comments, or concerns about any of the changes proposed in the bylaws? Okay. Anyone opposed to moving forward with the changes, please speak up now. Okay. All right, the motion passes. Thanks, Kimberly.
Great, thank you.
All right. So up next, we're kind of going to go a little bit out of order. We're going to do the presentation from Dr. Jeff Beckman. He is the Medical Director and Associate Division Director for the Health Facilities and Emergency Medical Services Division with CDPHE. And he's just going to give us an update on the COVID response on the state level and what's going on with the CDPHE. Jeff, are you there? You may be muted. You may need to.
Okay, thanks.
There you go.
On shift today, but thanks, Vicki, for the opportunity to present. So can folks hear me okay?
Sure can.
We can, and Doctor, if you have a presentation, I can give you presentation control.
Okay, great. I'm going to go ahead and attempt to do that here.
Good.
So thanks, Daryl. And can folks see my screen here?
We sure can.
Perfect.
Yep.
All right. Well, thanks, everyone. So not only am I the Associate Division Director, but the Medical Director for EMS of the state, but I have the opportunity of being the Co-Medical Director for JeffCom. So Vicki does a great job keeping me in order. So it's a great organization, and thanks, Vicki, for the opportunity to come and speak with you all here.
Thanks for being here.
You got it. So I know that your time is pretty valuable, so I'm hoping to get this presentation within 20 minutes and also get some opportunity to field some questions. First, I would like to honor the memory of Paul Carey. So Paul Carey was a paramedic who had worked for Aurora Fire for 32 years. And in that 32-year service to Aurora Fire, he had recently retired and then started working with ambulance. And then his dedication went further that he had volunteered to serve in the response in New York City. While working in New York, Paul had fallen to COVID-19 pneumonia and then eventually passed in New York. And we did have the honor to receive him in Colorado 2 weeks ago. Very moving experience, and certainly Paul has been an extremely valuable provider and leader in EMS for decades. So just want to bring this home that Paul was our first EMS provider that had fallen from Colorado for this illness. So even though that we are seeing a low incidence of death with this illness, it certainly can affect us, and we need to keep our guard up and continue precautions and follow in Paul's memory. So first, I want to go over a little bit of what's out there in the media, social media, and try to focus more on the facts. So with the attention and the explosion of the media with coronavirus, it is very difficult, I think, for anyone and even medical professionals to navigate this tremendous sea of information that comes through. There's reports on drugs that work, that don't work. Hydroxychloroquine has certainly received a lot of media attention. There is some ongoing work with the antiviral remdesivir, but at this point, we're still waiting on conclusive science to identify a treatment. Also, there has been attention to the novel that was put out in the early 80s by Dean Koontz. And in this, he had referred to a Wuhan 400 pandemic virus. Additionally, there's been a lot of media attention to a Harvard professor who also did have a connection with the Wuhan laboratory, and whether or not this was actually a biomechanism used for biomechanical warfare. Lots of controversy out there. In the UK, there was discussion and a lot of media attention that the 5G network had brought the illness over from China, and that was certainly recently debunked. And then there's been a lot of attention to this documentary of the Plandemic, which was touted by a discredited scientist, but brought forward a lot of controversies that weren't really well vetted in the scientific literature. And then there's folks that spend all of their time debunking all of these conspiracy theories. So really, in the effort not to really focus the time here on debunking all those, let's go through a little bit of the clinical features and what we see in Colorado. So the reason why they call this virus the coronavirus is that it has these crown-like spikes, if you can see here in the microscopy, and that's where it did get the name from corona. So it did not come from Mexico and not due to the Corona beer. So this is certainly a microscopy manifestation. And the one thing about coronaviruses is they are endemic and a common cause of the cold. So there are many normal seasonal human types that we see throughout, but this is a novel, meaning a different mutated form, which causes certainly a very different illness than the common cold. So signs that we have heard and have evolved over several months with cases, I think have rested here. So fever is something that we see, but only in about 40% of all folks that have COVID-19. So fever in itself is not a reasonable thing to exclude illness in folks. Then other signs and symptoms we see are cough, sore throat, shortness of breath, headache, body aches, and interestingly, there is an association with loss of smell or taste or disturbance. In fact, I had two providers that came down with the illness, and that was the primary symptom that they had, is they couldn't smell or taste anything. So as we discussed right now, there is no definitive treatment that is curative out there in the literature, although there are ongoing studies, and currently we're waiting for a vaccine to be developed for this. As far as the transmission, it is person to person. A 6 feet barrier is usually the range of where this is transmitted, and it does transmit both in respiratory droplets in the air, but also can remain on surfaces for up to 72 hours. So the importance is that the mask may help you with the airborne component, but certainly it's on surfaces, it may be on food that folks have prepared. And so it is really important to have very routine washing of the hands. Soap and water for 20 seconds and repeat. And the other thing that we are seeing is that there is somewhere around the 12% rate of asymptomatic folks that have COVID with some widespread testing. So even all these things that we have to our diagnostic tools to identify these folks are not necessarily catching all the cases. So that's just one more important thing to consider. So just to give everyone out there, when you hear these calls of folks with shortness of breath or severe distress, just wanted to give you a picture of what it looks like clinically. So this is a patient in their 50s that developed COVID-19 pneumonia, and this white patchy ground glass pattern in this chest x-ray that I'm showing here is a classic form of this pneumonia. Very different than bacterial pneumonias and very different than other viral pneumonias we've seen in the past. So this kind of gives you kind of some follow-up in some of these calls that you've taken of patients with respiratory distress. This is what their lungs look like, so pretty severe. Also, what we've seen is folks in their younger years have developed strokes as a complication of COVID-19. And we're seeing this in young patients in their 20s, 30s, 40s, and 50s. So this was described in the New England Journal of Medicine. And what we found is the COVID-19 illness can precipitate a hypercoagulable state. So with this, we see pulmonary embolus, so blood clots and strokes. So when we get that call of someone in their 30s who's had a recent respiratory illness and has one side weakness or speech difficulty, dizziness, other things, then we need to keep stroke on our radar, especially in those folks that have had any respiratory illness. One other thing that we're seeing in evolution is in our younger patients, an association of COVID with Kawasaki's and this severe toxic shock inflammatory syndrome. And the way that this would be presented is as a fever and a rash in a kiddo. So typically we usually don't lead much into that as viral syndromes, but for these conditions it can be serious. So patients may present with confusion, altered mentation, but in any way we want to have a high alert on those pediatric patients with fever, rash, and respiratory symptoms that they do get definitive care to a pediatric center, because these patients can have complications of heart-related issues and then also shock to their system and organs. So I just wanted to take a little bit of time now to go through some of the world data, then concentrate on our Colorado data. So this is a good graph of a picture of the world currently as it sits. The darker areas show where countries have the most highest incidence of cases within a 7-day period. So the darker area right now in the US is far exceeding any other country in the world. And so we are the epicenter of the COVID pandemic as we speak. China, Australia, seeing the yellow, have had significant decrease in cases. So they've had really good containment. But this just gives you a general sense of the pandemic when we look at a worldwide picture. In Colorado, we did over this week finally exceed over 1,000 deaths. We have over 20,000 cases. And so our case report mortality is somewhere around 5%. We are testing quite a bit more. So we've eclipsed 100,000 tests total. And we do see our hospitals with 3,700 total hospitalizations. I would say that the volumes overall for EMS and hospitals as far as transports have decreased. So we have seen that number decrease, and also decrease in overall deaths. The one area where we've seen a continued rise is outbreaks, and especially we're concerned about long-term care facilities, because I'll show you some slides later on that really identifies our older adults are the most vulnerable population. When we look at our case reports, we see that in March is where we saw that exponential rise. So if you look at the late part of March, that really shows the effectiveness of those stay-at-home. So if we did not have that aggressive stay-at-home orders, we would have expected that exponential rise to exceed up into the 500 to 1,000 case reports. The one thing to note that we see a plateau in number of cases identified, and that is largely due to the increase in tests. So when we look at, a epi curve, and this is just important to get a good idea of where a county sits. So I just picked Jefferson County as an example. There is still growth of cases currently. And so this is a good idea that we are still seeing cases, and those identified cases are continuing to come in. And I'll show you a little bit why that's not as concerning as we would think as we open up our economy to the safer at home. So this just goes into deaths, and the counties experiencing the most deaths, as we would expect, are the top 5 are some of our more populous counties in Denver, Arapahoe, Jefferson, and Adams. But interestingly, Weld at 119 deaths certainly has per population the highest death rate in any other country in our state. So this right here gives a good example of when we look at the overall effect of COVID-19 on our age distribution. So if you look at the light gray, those are patients that have had positive tests, but not hospitalized. So these folks are folks that had positive tests but stayed at home. The light blue is actually folks that required hospitalization. And then we look at the dark navy blue, and those are actual deaths. So when we look at this breakdown, we see that over 50% of our deaths are going to be in the age of over the age of 80, and over 75% of our deaths are over the age of 60. So this is why there's been a tremendous amount of effort in mitigating spread to our long-term care communities, because this clearly shows that for deaths, our older adults are at most risk. Now, that being said, is we do see deaths happen in younger age groups. So even though it's less a risk, no one is essentially immune to the effects of this COVID pandemic. And this is one of the slides where it has really directed the state to see how we can reopen commerce and economy in a safer at home directive. And this shows that even though we have had a plateau of cases identified, we've had a decreasing amount of deaths. And again, this has really been all mitigated from that very aggressive stay-at-home orders that were implemented in the late part of March. So these projections are just to give a sense of, well, how long are we really going to be in this pandemic? And when could we potentially expect a second spike? So the SD is the social distance, and our epidemiologists at CDPHE put these graphs together to try to get a picture of the effects of social distancing and where we may or may not see a second peak. And there's lots of different scenarios. So the first scenario is just that we release everyone back into the community, and just tell folks to continue social distancing. And really, when we look at this, I want folks to look at the ICU need, which is really where we've driven a lot of this to try to keep our resources within our hospital capability. So currently we have around 2,000 ICU beds with the ability to potentially surge up to 5,000 beds. So when we move to scenario B, which is social distancing throughout the community, but keeping our older adults over the age of 60 at home, and we see in that first graph anywhere in effect of 35% social distancing would put our ICU need over 10,000 to if 65%, which would keep the curve flat. So those are essentially the range of the projections of what that effect would be. Just to give some folks some perspective, our current stay-at-home orders, we are achieving a 75% social distancing. So again, as we open up our economy, as we open up folks in the community, we certainly will expect that to decrease, but we're not exactly certain where that will be among those different scenarios. So that's why we've really put campaigns to have folks that wear masks in the community, which gives you scenario C, but just that alone and then social distancing and keeping folks over the age of 60 doesn't necessarily mitigate the middle range where we're still exceeding that 5,000 bed capability. So we know we need to do more. So additional efforts are being put to aggressive case detection, control, and containment. So that case detection with having strong public health involvement of identifying the cases, quarantine, and containment has been an additional strategy which will bring down that curve. So again, if we look at the best case scenario in F, where we have social distancing, keeping our older adults at home, everyone's wearing masks in the community, and we're continuing that aggressive case control, quarantine, and containment, we do see even at the worst case scenario that will never exceed our capability, and best case scenario will have a flattening of that curve. And the importance of a flattened curve is that flattened curve means that there's less cases overall and significantly less deaths. And certainly we know that the population most to benefit for this is at age 60 or older. So we're really protecting our older adults in this scenarios. So give a reference of how deadly coronavirus is, we see kind of, if you look at the right side of the curve where you see measles, measles is extremely contagious, very easy to get, so it spreads very fast. And then if you look at the high part of the curve, we see Ebola, bird flu, smallpox, and Spanish flu. Interestingly, I also want to mention SARS and MERS. So both SARS and MERS are actually coronaviruses. In 2002, I was part of a medical deployment to Nepal where we had screened folks coming from China into India, and we were screening for SARS. And overall, that was just several thousand cases. MERS had even less cases, up to 3,000 to 4,000, but a 34% mortality. So when we look at COVID-19 in this pink shaded area, now what we're seeing is somewhere around a 2 to 3% mortality, but really it is much more contagious than SARS or MERS. And that's why we're seeing this significant more increase in cases and everything else. So really this X should be pushed over here to being similar or contagious as between polio and chickenpox right in here. When we look at overall the effect of COVID-19 versus routine flu, when we look at death certificates, even when we had the H1N1 flu season in the 2017 era, we only saw about 11% of death certificates at the worst part of that illness outbreak. When we look at COVID-19, certainly it is not the flu and much more deadly with over 20 4% of all death certificates coming forward. So again, just want to make sure that we reemphasize that this is very different than just another deadly flu. It is something different entirely. But with all that said, I want to end on this. And I think we've seen all the numbers and we're all having a degree of fear, but we are making significant gains. And this was a hospital in Mount Fiore, New York, where with each discharge, they did play the Beatles tune, Here Comes the Sun. So this was their 400th patient that they discharged from that hospital. So again, it's good to reflect on that. We, in the middle of this pandemic, we are getting some victories and some wins, and we're making some ground. So overall, again, we may be in this for several months, but we're getting, some bit of headway. And again, I think it's good to recognize that through all the struggles, we are making some victories there as well. Okay, so that ends my presentation there. Hopefully that was informative to the group, and certainly want to be available for any questions that we have out there.
This is
Dr.
Daryl.
Oh,
Go ahead. Go ahead.
Doctor, I'm just going to ask you, would you mind talking a little bit about what the state's done as far as the temporary facilities and the plans for, ramping up the transports and all that kind of stuff that we've worked on as a PSAP group?
Great. No, I think that's a great question and very pertinent to this group. So with the anticipation that in those modeling, if we ever do exceed the hospital capacity, there has been development of alternate care sites. So currently the identified sites are at the Denver Convention Center, or at the Ranch in Loveland, St. Mary's Corwin in Pueblo, and then also St. Anthony's North Pavilions. With that, the state understood that in that really just overwhelming scenario where we're having to surge movement of patients from hospitals to other alternate care facilities, we're not going to necessarily be able to rely on our typical interfacility transport systems. So with that, there has been a patient transport dispatch essentially created the state, and we've had really good engagement from many of you in helping build that. And then Kevin Schmidt and John Putt have been instrumental in developing that. And essentially is a call process where the hospital can call us for an available van transport or ambulance transport in between the hospital and the alternate care site, just so we don't impact the normal interfacility transport pathways, and also we don't encumber EMS and the 911 arena. So those systems have been built. It's just that at this point, hospitals are very low at almost 30% of their total capacity. So we're waiting on making, those two arms, the alternate care sites and the patient transport dispatch operational when we see the need of when hospitals and nursing facilities need to surge some of those patients.
Great. Thank you.
So this is Daryl Branson. Jerry Delval sent a chat message with the same question I was going to ask, and that was, what do we know about immunity from being previously infected and reinfection with people that have been sick with COVID-19 previously?
No, that's a great question. So overall, from some of the science, if there's been a significant COVID-19 illness, then there is some data to suggest that would provide some level of immunity to reinfection. Now, I think the bigger question is, well, what about folks that have either had asymptomatic illness, mild illness, and then the general population? Is there a way to kind of identify folks that may have had illness and may have some level of immunity? So that really brings into where there's current work during doing studies and testing for antibodies. So currently there's multiple antibody tests out there, most of which are not FDA approved, and many have false positives or false negatives. So there's not really one test out there that has a good measure of kind of the community, I guess, exposure, if you will, to COVID-19 based on antibody detection. And then also it's unclear which antibody actually gives someone the immunity. So I know there's lots of IgG antibody tests, but currently right now, we don't understand what would be the one protective antibody out there. And if you do have a positive antibody test, does that really protect someone from reinfection? So there's still more work that needs to really come from there, but I do see that's going to change pretty rapidly in the next month to 2 months, that we can have a really good antibody test that can identify if someone's had the illness, and then also potentially give some idea if that person also would have immunity to reinfection. But currently right now, the science just isn't there. So great question.
Thank you, Doctor. We also had a question from Tina Bunetta with City of Aurora. She says, I recently noticed an adjustment of the CDC numbers related to cause of death, presumed versus tested, and an adjustment downward. Do you know if Colorado is also adjusting their statistical data using the same methods?
That's a great question. We did. So we did look back at some prior death records where there was a presumed respiratory illness and suspected COVID. And that was where we did see a transient spike in deaths in April. And now that that process has been implemented, we certainly haven't picked up any additional deaths because there's pretty widespread use of the COVID-19 codes for those deaths that are uncovered.
I've got a question. That juvenile multi-inflammatory syndrome thing, do you have any idea what percentage of kids that are infected are getting that?
No, that's a great question. So in New York, and I'm just putting their example, who's had nearly 100,000 cases, they've only had 15 case reports. So it's felt to be a very rare syndrome. So even in the kids that get COVID, a very rare occurrence. They're not quite sure what that percentage is. So I hesitate to give a number other than just say it's uncommon and rare, but certainly something that we need to keep our radar on, because for folks that have those complications, they can get sick very quickly. And then also there can be cardiac manifestations and complications from those two illnesses.
The other thing is I've seen statistics and animations that supposedly the virus remains viable on surfaces or some surfaces for like a day, and in the air, if somebody coughs, it hangs in the air and spreads all over, and it can be there for like hours. And the two questions, is that true? And the other question is, what viral load do you have to have? Do you have to be indoors and have people coughing, or outdoors? Does it get dispersed enough?
Right. No, that's a great question. And certainly there's a very broad difference between outdoors, where it disseminates pretty rapidly, versus indoors, where you're looking at a contained unit, especially if there's no HVAC or negative pressure rooms. So with respiratory droplets that can be airborne, certainly that's someone coughing or sneezing. Now, the important thing to remember is that a mask, just a routine face covering, can actually prevent up to 95% of that airborne transmission. And I think that really lends the importance of mask wearing in the public, because that is a significant infection control maneuver. As far as outside, the virus, in exposure to UV light has a very limited time of activity versus indoors that are not essentially routinely cleaned. If it remains on a surface, it can be somewhere up to 48 hours, up to 72 hours, depending on how large the respiratory droplet was. So, certainly much more risk indoors, and just kind of brings home the point of good hand washing and good cleaning of surfaces. And I think it really, really begs that if we can really endorse the mask wearing in public, that's going to be a significant vector control from transmission.
Daryl, this is Jeff. I have a question.
Go ahead, Jeff.
Doctor, this is Jeff Irvin. I'm with the Jefferson County Emergency Communications Authority, and there's been a great outpouring of response from restaurants and folks donating prepared food to not only our emergency communication centers, but also other first responders. And I'm just curious as to what precautions, assuming this is prepared cooked food versus other types of food, what kind of caution would you give to accepting that?
Yeah, no, I think that's an important point. And, really, as far as the preparation of food, which makes it really important for folks that are doing that, have routine hand washing, glove wearing, mask wearing. But again, they're receiving the beverage and food items. You can't always assume that. So, certainly if you can clean or wipe down the containers is really kind of the main things. The food items themselves, if you can reheat it, certainly that would be one thing. But otherwise, for the most part, it's felt to be a fairly low risk of the food itself, but more so the containers and the surfaces in which they're transported.
Okay.
Anyone else? Okay.
Did we lose him?
I think he had a side conversation he muted for. Does anybody else have any additional questions for Dr. Beckman?
Oh, I'm sorry about that. Yeah, thanks, guys. Was there another question that I missed?
We were just asking.
This is Cheryl with a question.
Yeah.
First of all, she said thank you for your information. Do you have the what? Can I have your email? If I may add, Cheryl is speech impaired, so it would be a lot quicker if she could email you her questions. And no, I haven't been drinking.
Okay. Now that would be happy, and Vicky can help coordinate that to me. Happy to answer any questions. I think there was one thing that I did look on here about, and I want to make sure that we really debunk this myth about mask wearing and making that increasing your infection. So really, the mask, what it does is it prevents inspiration of respiratory particles in the environment. But it certainly is not going to increase the person's level of infection by wearing the mask. So that is something that we really need to debunk. There's no solid science behind it. That if someone currently has the infection, wearing a mask isn't going to certainly make that person more infected. They already have the infection. But certainly wearing the mask in someone who does not have infection is preventative. And again, a strong barrier to getting any of those respiratory droplets. So overall, needs to be really encouraged. That there should not be any fears of wearing masks because it could only help.
The misinformation campaigns that have been going around have really astounded me, and I'm thankful to you for providing that debunking information. It seems like as fast as experts are debunking the misinformation, other people are coming up with new conspiracy theories.
For sure.
It is, and I understand, and I hear this from all over. I mean, there's just so much information out there, and so many websites, and so many documentaries and video testimonies, and there's even some physicians who get on and are speaking out of their lane per se, or not experts, but making broad estimates and broad generalizations where really the expertise has to be really focused. What's the CDC, what's coming out of the medical journals, and using our local and state public health officials to really be delivering the information is really important during this time.
For sure. All right. Well, thank you so much, Dr. Beckman. Really appreciate you taking time out of your busy schedule and speaking with us. I really appreciate it.
All right. Thanks, everyone. Thanks, Vicki. And certainly if there's any questions you'd like to direct through Vicki, happy to answer those offline too. And appreciate the opportunity to talk with you all. So thank you.
Sounds good. Thank you so much. All right. So what do we got here? We have got the Equal Access Committee up next, Cheryl.
She said, yes, ma'am.
You have an update?
Oh, anyway, yeah, Cheryl has something for me to read. She says, I would, first of all, I would like to do a safety check with everyone. Please email me at pwd.resource@gmail.com. She said, I am well aware of how stressful our current situation is, and self-care is vital. So I think she's referring to that one doctor who committed suicide, showing there are lots of signs of PTSD amongst our medical professionals. So she's really concerned about everybody being safe, and your mental health is good. And so she said, moving on, I have been on the NENA Accessibility Committee conference calls. This group is very engaging. I have a conference call tomorrow with their two co-chairs. I have asked Luke Adams to do a 911 VRS test call through Athena and Shelley. Richard Ray from NENA informed me this goal is to have direct to 911 as opposed to going through a third party like VRS, TRS. Also, I just sent April's Technology and Disability Policy from Georgia Tech to Daryl. This is such a good read. I encourage all to read it. Also, I have joined the COVAD Communications Committee with Brian Wagner, Serve Colorado. We'll start reporting out on this. The NENA conference dates have been changed from June to September 26th through 29 in Long Beach, California. And I will send this to Daryl because it has the website nena.org/page/NENA2020. And as a side note, Cheryl says, Gil and I have been asked to participate in a COVID-19 tracing app. And anything else you want to add to that, Cheryl? I was pretty brief with that. Any questions?
Any questions for Cheryl? Okay. Thanks for the update. Appreciate it. Up next, we've got the Outreach Committee.
And we have other business, so we're going to have to sign off.
All right. Thank you. Talk to you later. Okay, up next we got the outage committee. Daryl.
So the outage committee we just closed out one special investigation. I've just opened another one. Both were alley outages. One was multi-jurisdiction. This one, the new one, is just for Los Animas County, which has been experiencing some alley outages. And I don't know if this one is related to equipment at the center or if it was actually a basic emergency service outage, but we'll be investigating that. Both of those can be found on the, we go back to the task force, the main task force page, and then go to committees and outage committee. If you want to look at those special investigations, they are down here. This is the one that's going to be closed out soon. This is the new one that we just created. And then they will be attached to the next report from the task force to the commission and then move to the archive. And then, of course, I also want to remind everyone that the outage dashboard is available through here as well. It shows the 10 most recent outages that I've been notified of from the carriers, as well as in a couple of cases from public safety answering points using the form to notify me of other outages. One question I did receive recently about the graphs, because it only shows one outage in January and one outage in April, and they were asking why that is when you can see that there have been multiple outages since the beginning of the year. We're actually up to log number 14 for the year 2020. And the reason, and I put some additional language here to explain this, the outages in the charts themselves are only basic emergency service outages. So they're only outages from the point that they're collected by the basic emergency. Hey, I guess it would be helpful if I actually shared my screen, huh?
Ah, yeah. Okay. I didn't know if you were showing something, so.
Thank you, Kimberly, for speaking up, whereas nobody else did. They were just going to let me keep on talking.
I was hopeful it wasn't me messing something, so.
Okay.
Now we see the graphs. Looks beautiful. Thank you.
Thanks. So just to go back a little bit, so task force, committees, outage committee, down here is where the special investigations are. And then from here, you can also get to the outage dashboard by clicking that button. So the question I was answering was, why does it only show one outage for January and one outage for April? And I added some additional language here to help explain it. This only shows basic emergency service outages, which is from the point that the 911 call is aggregated by the basic emergency service provider, which is CenturyLink, to the point that it's handed off to the public safety answering point, either directly at the public safety answering point or whatever demarcation the PSAP and or 911 authority have arranged with CenturyLink. And it only shows closed outages because they can change quite a bit from the time that we receive them from CenturyLink to the time that it's closed with a final report. The details can change quite a bit, and I didn't want the graphs to wildly vary depending on those details. So it only shows closed basic emergency service outages, and that's why it shows so many fewer outages down here than you can see on this list of the last 10. Because these are the only two that we've had closed so far this year that fit that description of a basic emergency service outage. So I hope that answers that question, but if anybody else has any other questions about what they're looking at when they look at this page, I'd be happy to try to answer those. Okay, not hearing anything. That's my report for the outage committee.
So Daryl, this is Kimberly. Can I just
Sure.
jump in? So from an outage perspective, Daryl created this form, and the form will track outages. It's not so much maybe a basic emergency service outage, but it's also helpful information that we can enter in to track and then share information with each other about service impacts or something going on. So the most recent one would have been Verizon. Right. So that one actually was a 911, somewhat of a 911 impact, because they could call 911, but they wouldn't have voice travel with their phone call if they did get connected. So one thing that I've been doing, and then he's been closing them out just to kind of track and get some visibility, is been placing them in this form. That way we don't truly know the scope when we receive that notification from the carrier. We don't know if it's going to be a 911 outage, if it's what kind of service is being impacted, the extent of the impact. So I've been trying to just log them here. We've had issues with T-Mobile. We had issues during the stay-at-home order early on with lots of carriers just getting too much traffic. It was AT&T, Verizon mainly. So I was posting that information on WebEOC, but just wanted to bring some visibility to that and maybe even some discussion around this tool and if expanding use. I mean, it's voluntary reporting, but I do think it's somewhat helpful to have a central repository of these kinds of impacts.
And Kimberly, I'm glad you brought that up because we've actually got, so if you go to this is the outage committee page, and down at the bottom, there's report 911 outage or issue. And there's two different options here, one for telecommunications provider, and that's what we use to fill in that outage dashboard page. But then a while back, we also created, and I think this is what you're referring to, the 911 authority or PSAP voluntary outage reporting. And it's similar in the, it shows the, the last, I think it's set up for the last 20 most recent entries. And if you would have a new report to send in, you can click this and it sends you to a form that you can fill in. I'm wondering if it might not be better because Kimberly, you've also sent a couple in using the telecommunications provider form, and I don't mind that. But I'm wondering if it might be better to just do that as make one form for both, and then it can be just one place so that they can all show up on the outage dashboard page instead of having a separate page for 911 reported or a local 911 center reported outages. I wonder if you have any thoughts about that.
I think one form is probably good because you can easily sort, close out, move over anything that's not BES or 911 specific outage that we're tracking within the core of the network, but something that's perhaps impacting a community. So it would be good to probably have one central place for it as long as it doesn't create too much work for you in sorting everything.
It wouldn't because I already got it sorted out where it will only show the basic emergency service outages in the chart, so that's already filtered. I'm just thinking it might be more useful and more visible if we only have one chart instead of having two separate charts. So why don't we talk about that at our next outage committee meeting, but I think that might be the direction to go on that.
Yeah, I think that's good.
Any other questions or comments on outage committee report?
Okay. All right. Prepaid and collections committee, Jackie.
Hey, this is Jackie. I haven't pulled together a call yet, but I was waiting to kind of see what happened with the legislation. But moving forward, I think that once the EZNet we're getting reports from the EZNet, we will need to make sure that those statistics work for us for the prepaid collections out to the 911 authorities.
Okay.
Jackie, something to kind of put on the radar for that is, I get the ALI retrieval reports by PSAP or by PSAP node, essentially, from CenturyLink, and that's what we've been using for the last several years to put together the prepaid percentages for DOR to do the distributions. And in the past, we haven't added those up statewide, so there was no way for it to jump out that the numbers that if you add up all of those ALI retrieval reports statewide, they don't match the numbers that we're getting from CenturyLink on an annual basis for statewide ALI retrieval numbers. Mm-hmm. So I think that's something we need to clarify with CenturyLink maybe at a future prepaid and collections meeting.
Okay. Why don't I set one up, say midsummer?
Okay, and let's make sure CenturyLink can be on the call.
Okay, I will do that.
Great. Anything else for Jackie? Any other questions? Reports committee, Daryl.
Following our practice of providing a report to the task force, from the task force to the commission every other task force meeting, we do not have a report to approve at this meeting. but I will send a report out to the reports committee prior to our July meeting so that we can approve one at the July meeting.
Great. Okay. EZNet Users Group, Bruce.
Actually, Kimberly is the chair now, so I'm sorry, I did that.
Sorry. Didn't mean
It's
to
okay.
ditch you, Kimberly.
No, I'm fine. In fact, if Bruce wants to take it. um, so, well, we have a lot. So I don't know if you want to go to the report that I typed up. Daryl, I'm not going to read this to everyone, but I just want to highlight a few pieces here. So the group met yesterday, so everyone should have received an invite. We are meeting in one combined meeting the second Wednesday of the month versus having two separate meetings. So the invites have been changed and hopefully your calendars were updated accordingly. And then we meet every Friday for those PSAPs that are getting ready to cut. So within 30 days of your cut time, you'll get a meeting invite to join us every Friday so we can have weekly touch points to talk through how your project is going, delivery of equipment, personnel movement around your PSAP, access, any limitations, etc. So from a meeting frequency, I think that's going pretty well. I would just encourage everybody in between meetings, if you have items, don't wait so we can start talking through them. So reach out at any time for questions, or if you're having problems getting connected or getting a response back, that's what the user group's for. So reach out so we can work collectively on that. From a big picture, Denver migrated on Tuesday. So congrats to Denver. No issues or minimal issues is what were reported post-cut. So that's fantastic. So they're added, and it's Denver, Denver's backup, and also DIA. So all of them migrated on the same day. So they did a great job. So it's great to have all of that done. And then we do have some issues we're tracking, and so I have them bulleted out there. And the issues really that we're working through right now is we have a big group of PSAPs that are on the to be determined field where they had to get moved for various reasons. A lot of it had to do with lockdowns for COVID-19. So the CenturyLink team is working on getting them plugged back in to the schedule. So I'm hoping that everyone had a chance to read the report, but does anybody have any questions from all that information included on the report or anything you want to talk through? Okay, so I think from a PSAP authority perspective, it's just really important to make sure that you have all of your items ready to go. So electrical has been a big one, making sure that your electrical is figured out and you know what's expected from an electrical specs, your rack, making sure there's rack space or you've identified if you need CenturyLink to provide a rack, and then also making sure you know if you're going to do the legacy handoff or the SIP handoff. So we've run into a couple of hurdles in that area. So again, just make sure that if you have questions that you're asking, and we'll work through them.
I just want to give, excuse me, sorry about that. I just want to give kudos to Kimberly for the amazing job she is doing organizing those meetings and keeping track of the vast amount of information that goes back and forth in there. If you are not attending these meetings, you are doing yourself and your IT staff a disservice because there are a lot of gotchas that have come up that have been discussed in these meetings and solutions essentially worked out in the meetings themselves. So you will make your migration much smoother if you or someone from your 911 authority or PSAP are attending these meetings.
Thanks, Daryl. And some people call it a sickness, but I do enjoy projects. So I just want to encourage you to also ask those questions. So sometimes if you feel like you're just confused, let's sit down, let's whiteboard it, let's do a virtual whiteboard, but let's figure it out, because the last thing you want to do is to be saying yes to something that really should have been a no. So it's much better to just work through those pieces. But I think our next cut, if I'm remembering correctly, is Vail. So that should be next on our list to move forward. And also, this is a great point too. Daryl just highlighted the spreadsheet, and the spreadsheet that we have was created by CenturyLink. It's a one-stop shop for dependencies. This isn't your project plan. Those resources are in a different folder, but this is just for you to track your dates and migration dates, when they're going to be installing circuits, when they're going to be wanting to coordinate racking equipment, and then your final cut date is in that far column all the way to the right. So take a look at that folder, take a look at the resources, and if something doesn't match, let's figure it out and let's find out why and get that fixed.
Actually, according to this, Vail was supposed to migrate today. Did Vail migrate today? Maybe that's why they're not on the call.
I think they got pushed because of some questions about firewall
Gotcha. Okay.
configurations, because they don't have a Vesta, they have a Patriot. So they were having some hiccups with that Patriot and some CP configurations, but
And then I know it's not on here, but I remember, was it Aurora's backup that's going on the 20th?
yes, that's the intent.
Okay. And then the next one after that is JeffCom on the 26th.
Right. If those dates may have to slip because of a firewall ordering and provisioning, but hopefully they won't have to slip more than a couple of days.
Hey, Kim, this is Tina in Aurora. Just a quick update for us. Our backup won't be transitioned over until June 3rd now. So they had just a few issues running the network in, but we're set for June 3rd at this point.
So we're really tired of them having issues with the network getting to that building. I don't know what's going on, but dang it. Okay, thanks for the update. And I know that's why you were delayed for so long, was getting the circuits just to that building. So
yes, it took some time for sure.
Yep. Great. So Vicki, I think that's all my report. If anybody has any other questions, they can either chat them or just feel free to email me.
Thanks for all your work on this, Kimberly. It's awesome.
You bet. You bet.
Okay. Up next, we've got the Colorado Public Safety Broadband update from Ed Mills. Did I see him fall off the call?
No, I've been switching back and forth. Can you hear me?
Oh, yep. Sure. Go right ahead, Ed. Thank you.
All right. Hey, I have a few things, and I do apologize. I'll turn in some notes next time so that you'll have that. I will do better. First thing we want to do is just do a shameless promotion. We have a lunch and learn series every month, and the Colorado Broadband Office is pleased to bring in May, on May 26, 2020 at 12 p.m., a lunch and learn featuring the 911 grant program. So in August 2019, most of you know, $109 million grant funding from the 911 grant program was announced for public safety answering points. To upgrade NG 911 capabilities. Colorado received $2.3 million in grant funds. So the session is going to provide information on the recent developments in the 911 grant program, and our own Daryl Branson will share how that $2.3 million in grant funds is being implemented in Colorado for migration of the PSAPs to the statewide emergency services IP network, EZNet. So if there's anyone that you know of that needs to understand that, this is a great opportunity. These have always been, they are not face-to-face meetings, they are teleconferences. So that's May 26th. You can find that on our website with the Colorado Broadband Office, the state of Colorado. Then just a few things, just to let you know that what we've been up to, and I think the things that might relate to your various areas. COVID response, we created a resource at the CBO on our website, just request about broadband and how that applies to folks out there. As you know, a lot of people, as they had to go to their homes and shelter in place, a lot of them had issues with broadband coverage. Shockingly, one of the most frequent requests that I had was somebody would call me and say, I'm a customer of X, whether it be Verizon, AT&T, Sprint, T-Mobile, and they said, how do I get connected with GETS? So you'll find tons of information that relate from everything from PSAPs, public safety, health, mental health, etc., and that's on our website. We have been working very intently and instrumental in bringing connectivity to the Ute Mountain Ute tribe and surrounding areas in Utah, and now expanding into New Mexico and the Navajo Nation. So fortunately, with our work that we've done with FirstNet and getting that up and running, we have a great relationship with all the carriers out there. And so we've been able to leverage that from time to time. As you'll remember, the fiber cut happened in Silverton last year. We were able to get resources out there, and there was a relatively short time that connectivity was down because of some of the work that we did. So all that is to say that if you are experiencing issues and you have any broadband mitigation that has to be done, please do not hesitate to reach out to us, and we will help you to the best of our abilities. For those of you who haven't heard, the merger between Sprint and T-Mobile is official. They called me, and they had a call to let us know basically that the merger was through. I still don't think that they know how that's going to work in the future, but I do believe that that will be a game changer, because with the two companies coming in together, they are going to provide they'll provide a run for their money for the bigger transport networks in the area. And then also, some of you will be very interested in this. We were planning on having a FirstNet powered by AT&T. We're supposed to have 2 reports each year. That was going to happen at the Radio Summit. And because the Radio Summit did not happen in May as we had planned, I'll be reaching out to Glenn to find some time that we can schedule a presentation for the PSCS so that we can hear from FirstNet powered by AT&T concerning the build out of FirstNet. Now, the caveat here is that because it will not be a face-to-face meeting, they will not be able to go into the level of detail that we expect. For example, if you have a tower that's being built in your area, they won't be able to drill down that specific. But I have requested that they give contact information in that presentation that will be online, and they will let you know how to get in touch with them so that you can get more specific information about towers being built in your area. Our office was instrumental last year in Summit County, or actually it's been about maybe 2 years ago, in negotiating a deal that not only the tower that was going to be built for FirstNet, but getting the community and the residents some access to that. And we were happy to hear this week that that has gone live. And so if you have similar requests in the area, please reach out to me, and we'll see what we can do. Last thing I'd like to mention is that we've been working with a company called Arcadian Infracom. And Arcadian Infracom, basically, they're trying to bridge the broadband desert, and especially that we see here in rural Colorado. And so we've been working with them to try and get them access to the Southern Ute tribe, as well as to make a connection with CDOT. They have a plan to use the right-of-way access to build, actually to lay fiber up 550, 160, which is up over Wolf Creek Pass, and then eventually to go into 285. And so right now I am scheduling meetings along the way, like in Bayfield, Del Norte, Saguache, Poncha Springs, Highway 24 to Leadville, Fairplay, Highway 9, you get the point. But there's an opportunity there for us to lay access points to fiber and broadband. We also bring in the Northwest and the Southwest COG so that they can help communities maybe leverage that infrastructure. So again, if any of that pathway interests you, again, please reach out to me and let me get some meetings scheduled so that you can talk about the implications of that, and if there's any possibility of getting some access to broadband. And I'll leave it there. Does anyone have any questions for me?
a map of that broadband route you're just discussing available that you can release?
Let me see if I can throw something together, if there's something releasable. Again, it's going to go up to Southern Ute to 160, and then, you know, up over Wolf Creek to 285. But if you'd contact me, and I'll go ahead and text out my email and my phone number, contact me and let me see what I can send to you.
Maybe get to Darrell. My concern is on the diversity committee where we're looking at, you know, increasing diversity to the PSAPs. There may be some in those areas. I don't know the road numbers all enough to, or the map of where we have diversity, but that could be very helpful if you're putting fiber in for those sorts of purposes.
Absolutely, and we have identified some of the areas that we know of because of the fine work from this group and others. But yeah, anybody that would like to leverage this opportunity, we certainly want to talk to you.
Yeah.
Yeah, and Ed and Teresa Ferguson from the broadband office both participate on those diversity calls as well. So they've seen the maps that are in the confidential folder. They've signed the NDAs, so they at least have an idea of where those areas are.
That's correct.
Just a note on the May 26th thing. I know pretty much everybody on this call knows how Colorado is using its 911 grant funding because you're intimately part of that process. But I wanted to assure you that my part of that presentation will be small. There's also someone from NTIA who's going to be at that Lunch and Learn, who's going to be talking about how the money is being used on a national level. So I think getting the perspective of what other states are doing with their grant funding would be very helpful. So I wanted to make a plug for people attending that to hear what other states are doing, and it might give us some ideas going forward of things that we can do in Colorado to help move us closer to true next gen.
Yeah, and in trying to save time and also you know, give kudos to Darrell, I did forget to mention that. So yes, we're excited about it, and it's great. It's a great presentation for us to hear and learn more. So with that, I'll shut up and thank you for the time.
Thank you, Ed. That was really good information. Appreciate it. Okay, up next we got the PSCS report. Deanie, do you have an update?
We actually haven't met for April and May, so we'll defer to the next presentation.
Next meeting, okay. Quick report, Glenn Kleisch.
Oh, good morning. Just an update following up on the PSCS. That's correct. The meetings have not been held for the past couple of months. We do plan to have the June meeting. It will be virtual. As Ed mentioned, we did have to cancel the radio summit because of COVID-19, so we'll have that scheduled for next year. I was unable to attend the task force meeting last month, so didn't update a couple of the projects we have working, helping PSAPs. Had a conference call to get started with our federal partners on the PSAP cybersecurity webinars. We're going to have 3 of those coming up later this year to provide some good in-depth detail on PSAP cybersecurity, as well as the next generation 911 strategic planning. Have a lot of help with from Kimberly, Darrell, Monica, Bruce, and others on that. So we appreciate all the assistance on that. Not a lot new from my world right now. Been tied up with helping the state EOC and working on that and some IPAWS things. So if there's anything that you guys need help with, please let me know. But to wrap it up briefly, that's my report. Any questions?
Okay.
All right, thank you.
Thanks, Glenn. Appreciate it. Monica, I've got the Division of Fire Prevention and Control report.
Thanks, Vicki. Yeah, Vicki attended the last meeting for me back in February because I was traveling a lot at the time. There really hasn't been too much activity since then. There has not been another meeting. Our April meeting got postponed. We're actually meeting via Zoom on May 27th. And we're really trying to finalize some of the concepts and points that the Fire Commission wants to make to the governor. So anything more than that, I really don't have at this time, but after the May 27th meeting, I'm sure I'll have some points of interest to share with you guys. That's all I have, Vicki.
Great, thanks. All right. So then, do we need to take a bio break or anything? It's been a couple hours.
I was going to suggest that now is normally when we would take a break to everybody to get food. So maybe we should do virtually, maybe take 15 minutes so people can heat up a lunch to eat while we finish up the meeting.
Okay, how about we get started back up at 12:10?
Okay. And I'll leave the webcast open so that nobody has to dial back in.
Perfect. All right. See everybody in 15 minutes. 12:10. Did you dial into any of the meetings? The PUC task force meeting?
Hi, Vicky. I'm ready to go whenever you are. But if you want a couple more minutes, I'm good with that too. Can anybody hear me?
I can hear you.
Yes.
Okay, good.
Yeah,
I can hear you.
I just want to make sure I didn't lose connection there.
So we'll be starting back up in about 3 minutes.
Are you trying to make us laugh, Daryl? That's a good one.
Yeah, that cat is the best.
Look at that picture of me.
That's awesome.
This is me. This is what I picture when everybody's typing messages in chat during one of these meetings.
I relate more to the Bruce Almighty one, just for the record.
So we're supposed to be typing in the chat more often for you, Daryl?
Hey, whatever works. At least it's convenient. There you go. There's Bruce Almighty.
Awesome.
It's been so long since I've gotten my hair done. I look just like that too.
I was going to say, I wonder if any of us have tested our typing speed, because I have to imagine it's ramped up considerably during all of this craziness.
Right.
I don't know about that, but I've definitely improved the lighting in my office, you know, to get the best imagery.
That's a good one, Tina. Oh, God, that's a good one.
I
And then
saw.
the camera angle too. You don't want it you don't want it pointing up at your face. You want to be above your face.
Right.
Right.
I saw an article.
I pay more attention to my backdrop, stuff that's behind me. I didn't even notice until I see myself on camera, and I'm like, oh, I need to clean that up.
I saw an article about people using professional ring lighting for Zoom meetings, and I think if you get to that point, you're going a little too far.
Mm-hmm.
There's a Twitter account that, like, for the news, goes through and judges them, gives them like a 1 through 10.
I feel like nobody's been able to see me because I have windows, so I'm always backlit. So I'm always, look mysterious. At least that's what I'm going for.
You're like the Dateline NBC witness interview.
It's that, or this thing is making us so darn vain. It's ridiculous. Oh, yeah.
This is just good practice for when video to 911 comes in on a wide scale.
Amen.
Monica, I'm not sure about vain because I cut my own hair, and that's not.
I was bodily threatened by my hair gal because if I even attempted to cut my own hair, but I got my hair colored and cut a week ago Sunday because we're cool over here on the Western Slope, unlike our teammates in the metro area. Sorry, guys.
Well, I just used my beard trimmer last night on my sideburns, so I get it.
Daryl, I thought we were going to have to mute you there for a minute, but as I was dyeing my son's hair bright blue, for those of you who are Facebook friends with me, I actually considered putting some in my hair just for the hell of it, and then I was like, better not.
Well, I have been shocked to see my real hair color.
Exactly. I finally know what my natural hair color is.
Yeah, I know what mine is too. My new natural.
Uh-huh.
Kind of white.
You can go for that in style, like silver look, Jackie.
That's right. Except for now it's only like,
with the millennials.
yeah, right. Except for it's halfway down my head as opposed to, nice and move through my hair.
Do you think we're ready, Vicky?
Sorry, we're ready. Like visual.
Vicky?
Are you okay? The phone dropped me off. I'm like talking, saying, "Okay, let's get started," and yeah. So I apologize. You can hear me now, correct?
Correct.
Okay. All right. So next up, we've got the old business. We got the discussion of the draft best practices webpage. Daryl.
Turn my mic off temporarily to clear my throat. So I showed this at the last meeting. This was a recommendation that somebody made in January. I put it together and showed it to everybody at the March meeting with a request for people to provide input on it. I still have not received any input, so either I got it right the first time and everything in here is good to publish, or people have just been too busy, which is probably the more likely answer. We have the standards list that the task force approves every year for the commission to consider, and somebody suggested at the January meeting, I think it was Joe, that we put together a best practices list as well that's for the 911 centers. It's geared more towards operations and not so much the network stuff that the standards list is focused at. And so this list it was my attempt to do that, and I've sorted everything from that I could find from both NINA and APCO into different categories onto one page. And I've got it set up as a sub-page of the task force website, but right now it's not visible to people who go and visit the task force website. So the page exists, but it's not open to the public yet, unless everyone thinks that it is ready to be open to the public. And then, of course, it's not set in stone. So if you see anything in here that you think is incorrect, if it's categorized wrong, if there's a standard on here or a best practice on here that is outdated, we can always remove it. If there's anything missing, we can add to it later. So unless anybody has any suggestions today for improvements, what I would ask is that maybe we have a vote to approve this for publication, and then I'll just make the web page public so that it's accessible and visible from the task force website.
Okay. All right. Well, can I get a motion then to add this to the task force website?
Tina moves.
Got it, Tina. Thank you for your first one. Can I get a second?
Mandy, a second.
Thanks, Mandy. Do we have any discussion on this? Any questions or comments or feedback for Daryl? Okay, hearing none. If we have anyone who is opposed, please speak now. Okay, hearing none, motion passes. Thanks, Daryl. This looks terrific.
Cool. The next
cool.
item was a draft outline for a public education website. Well, actually, we started with the outline, but we actually have the website now. So let me get to that. Put it on view published site. So I think following the same thing we did with the other one, what I'm going to do today is just introduce the website to everyone, send the link out by email. This website exists, but I have it in private mode, so you cannot find it through a search engine, and there's no way to just link to it. So it's right now it's in draft mode essentially for everybody to look at. This started with a request from the executive director of DORA, who suggested that we should have an outward-facing public education website for 911. I think this is made a little bit more urgent by the fact that the Colorado 911 Foundation has closed down. We do want to have some sort of public education resources for 911 specifically for Colorado. So what I did was put together, based on the outline that I presented at the last task force meeting, I put together the web page that is based on that outline. Major topic areas here, what is 911? And then when you go to each of these pages, you can click on any one of these questions to get more information. So it's a collapsible text format. There's information on here about reverse 911 and smart 911. I would like to build this out with a lot more information that has been collected by the Colorado 911 Foundation. Bruce just asked the question if the foundation has determined that their assets can be transferred to the resource center. Joe, do you want to speak to that?
Can be. We just need to complete the dissolution. I'm hoping that'll all be done by the end of the month.
Good deal. One suggestion that was made when we were talking about this at the last meeting was to make sure that the page is accessible to people with various accessibility needs. As of right now, it's just a text page. For people with low vision, they can certainly increase the font size. But we also want to make we also talked about making a Spanish version of this as well. So those are all things that would still have to be done. But in the meantime, there's, the basic information that we had in the outline is on the web page, as well as additional resources, and put both myself and Monica as contacts at the bottom of the page. So, like I said, this is just an introduction. I'm not asking for a vote today. I'll send this link out to everybody so you can take a look at it and make suggestions. Let me know if I'm missing any crucial pieces of information that need to be added. But my hope is that this would be a good place to start at any rate. And like the other web page, the nice thing about it is that it's easy to make improvements or if there's anything missing, add to it or change anything that's incorrect. Obviously, I don't want to publish it if there's anything incorrect on it first, though, so please do take a look at it when I send the link out and let me know.
And Daryl, I don't know if you saw Jeff's comment about the foundation domain was 911colorado.org, and that if it's possible to retain that for this public site, maybe?
I did talk to Joe about that, and I think that we could certainly, if not retaining the domain for this website, we could certainly forward that domain to this website. So if people go looking for the old domain, they'll get this website instead. Because after I add the links into the reverse 911 and smart 911 section of this will essentially be trying to do the same thing that the old website did.
Okay, great.
The concerns is we had all those radio and TV spots produced, and if they ever get run again, they refer people to the 911colorado.org website.
Right.
Okay.
Yeah, in fact, we could have that domain linked directly to this page, which is where we'll have all the information about how to sign up with your local emergency notification service.
Hey, Daryl, this is Kimberly. Just one little point. Are we okay using that word reverse 911?
Yeah, that's the brand name.
Yeah.
Right.
Yeah, and the problem is that that's what the public calls it, but you're right. I mean, it is a brand name, and we might get in trouble for using it. So I'll have to think about that one.
The owner of that in the past actually went to court over that with some folks.
Okay, well, that kind of answers the question then.
Yeah.
I'm with Jeff Irvin,
did.
ENS.
Yeah, we referred to as emergency notification service, and then we put in parentheses, I think, sometimes referred to by the brand name, reverse 911.
Mm-hmm.
Yeah, I would just do the ENS emergency notification systems.
This is Monica. I echo those thoughts, and part of our whole problem in 911 is we're not good at defining or labeling ourselves. So I think emergency number service is the correct nomenclature.
Yeah, and that's why I'm showing this to you guys before it's published. So I appreciate that feedback.
Part of the problem is whenever their reverse 911 is run or ENS is used and they report on the news media, they refer to it as reverse 911. And so that's, it creates quite a bit of public confusion.
It does.
Well, and my greatest concern is it gives a false impression that there's some type of secret sauce that somehow those calls get a priority over all other calls, and they simply do not.
Yeah. Good point. Okay, so you're going to send out the link and then we'll give you some feedback?
Yep.
Great. Well, good job on that. It looks great from the surface anyway, so. Okay, so next on the agenda, we've got new business, discussion regarding the default text to 911 routing by region or statewide.
So we have really slowed down on new text to 911 deployments in Colorado. I think we may be reaching the end of what we get through local individual PSAP deployments. One thing I'm hoping for once we finally get fully deployed with the ESINet, maybe one of the first things the ESINet users group can look at is whether it's, whether it is feasible cost-wise and operationally to implement text to 911 statewide through the ESINet. But in the meantime, that's probably a couple of years away. And what I would like to have a discussion about, to sort of gauge the appetite for it, is the idea of creating regional default text to 911 centers. So the centers that already have text to 911 would still receive their own text to 911, but creating default locations where text to 911 would go for those counties that don't have it already. I think until we get statewide text to 911 deployment through the ESINet, I think it's the only way we're going to get to 100% coverage of text to 911. So to give you an idea of what I'm talking about, for instance, in the Northwest, we're fairly well covered with text to 911, except for Moffat County and what is that, Grand County?
Jackson.
Jackson County, excuse me, thank you.
Mm-hmm.
So one thing that we could do is identify a center in the Northwest part of the state that's willing to take text calls for both Moffat and Jackson, and then relay that information to Moffat and Jackson if they get a text to 911 call for them. Same thing in the southern part of the state. This is all one PSAP. This is all San Luis Valley. But if they're not capable yet of taking text to 911, maybe one of their neighbors can and take the text to 911 for them. Go ahead.
Based on one of our ESINet calls, they indicated that they were in the process of deploying.
Okay, so a bad example then. And where we do seem to have the biggest problem is on the eastern side of the state, the whole Eastern Plains. We've got Prowers County has text to 911, but most of the Eastern Plains does not. So perhaps one of the PSAPs up in the Northeast or maybe in the central part of the state could become the default center. So my thought is just to first have this discussion. Is this something we even want to explore? And if it is, what would be the best method for exploring that? What would be the first thing we would do? Would it be to reach out to potential default sites? Would it be better to reach out first to the sites that would be the recipient of the mutual aid from their neighbors? What does everybody think?
I got a question.
Vicki, I just had a question for Kimberly. Since you guys have offered and covered other jurisdictions for texting, I was just kind of curious how much, I'm assuming you're capturing the data as far as how many you guys are taking from these other jurisdictions. And secondly, do you know the places that you're covering for, did they actually put information out there that they had texting capability, or is it more like just in case somebody texts, you guys are getting them?
Yeah, so that's a great question. And I just wanted to also say that I'm such an advocate of getting the service statewide, period. And I think that's a plan we just have to move forward with. It's critical to the citizens.
Ditto.
We are no longer guarding for any of the other agencies, so guarding the old CBI terms. But when we did that, it was, they advertised as if they have text to 911, which they did. So they advertised, push it out to their citizens that they have text to 911. And we set up a dedicated phone line. So if one of our centers received that call, and it was Larimer County Sheriff's Department that the calls went to, if they received a call, they called the dedicated line for the dispatch center, and then they would just real-time relay the information. From a volume perspective, there was no concern. I mean, it's just, we have a pretty high volume of text calls up in Larimer County, but we also support a primary campus, and we advertise a lot. So our average at one point was in the 80s, 80 texts per month collectively across all 5 of our dispatch centers, and then we were guarding for 2 additional counties. So I think this is a great idea. I don't think it has to be by region, but it, from a jurisdiction perspective, what we also did was a map where we extended the map jurisdiction layers in our Pictometry Online application for those areas that we were taking the text calls, just so we could have that visual mapping information as well. So region would make sense just because you should, in theory, be familiar with your neighboring counties in that jurisdiction. But at the end of the day, we have to provide this service to our citizens. It's just not an option anymore. So whatever barrier these agencies are having, I think we got to remove it.
I absolutely agree. I think the reason why I ask those questions is more of, if we're trying to sell the concept to an existing text PSAP, to take this on, as to your point, it's not this low volume, but what kind of things they would need to be prepared for, I think, if we're going to be able to try to sell this, because I agree with you. I think it's incredibly important.
Well, and if a region doesn't want to do it, my offer is still on the table. We can take it from any of them. We don't mind. So I think the first step would be to contact each of these agencies and find out what barriers they're still having. And then we just determine, okay, if somebody was to take your text 911 calls, do you have a preference on where those go? Because we want to provide this accessibility for the citizens.
Yeah.
Kimberly, this is Monica, Vicky, and Daryl and Kimberly. I'm in full support, and frankly, I would love to take this on again. Bruce started this whole effort a few years ago, and I will take it upon myself, using our map that Daryl has put together, and contact each of the agencies and get some kind of information as to why they will not migrate. And then I can bring that back. Then I can bring that back to the task force. I'm sorry, Bruce, go ahead.
Monica, I was just going to say, I think that it could be more successful now because of the significant outreach that the Resource Center has done to the local authorities and PSAPs. I know you've been able to talk to some people in counties that I couldn't get to answer the phone. So possibly your luck with this might be a little bit better than what you had in the past.
Well, and I also think, Monica, you're able to speak from our relationship experience when we were taking the text messages on your behalf. And, we did a simple IGA. There wasn't a cost involved, and it was super simple. I mean, it didn't take us long at all to get those letters done and to extend it over to your boundary area. So you'll be able to talk to them about the minimal amount of work they'll have to do on their end to get it turned up.
Yeah, absolutely.
Hey, Kimberly, I'm pretty sure you've already sent these to us, but could you send me a copy of that IGA that you used?
Yeah, absolutely.
Thank you.
Daryl, do we know if the state patrol run PSAPs take texts, and if there are ones in these regions that we need coverage of?
They do not. So Moffett is one of them. They do not take text, and San Luis Valley is the other one. And according to Bruce, just told me that they are planning on taking text, but they're not at this time.
And this is Monica. I'll back that up because I've talked to him a few times. I know he's working on it, but I don't know what his current status is.
So my only thought about, reaching out to them again is, we had a regular contact reaching out, asking them when they were migrating and what their obstacles were so that we could help them overcome that. And, I think because of that constant contact, a number of PSAPs migrated to text 911 that wouldn't have done so otherwise, or wouldn't have done so as early. But like I said, the number of rollouts has really dropped off. I mean, it's really slowed down dramatically. So I think I'm not opposed to reaching out to them first and asking, if they plan on migrating and when they plan on migrating. But maybe we start that conversation with, when are you planning on migrating, and are there obstacles that we can help you with? And in the meantime, who would you like to take your text to 911 calls for you? And if we present it that way, maybe it will come off as more of a plan A and plan B rather than plan A or plan B.
Well, and I think, Daryl, I would even take it one step further to tell them that the 911 task force, who prepares a report to the commission, has identified a goal to have state end-to-end coverage of text to 911 by, call it a year, May of 2021. And what can we do to get that accomplished? I think it's a very valid goal that this task force can set.
I
agree. I agree, and I've copied down all of the things that you guys just posed. And again, if you'll give me the opportunity, I'll see what I can make happen. I will share too, in following up on the text deployment and following back up with the FCC's requirement with their registry. 5 of our counties that show in green do not show on the FCC registry, and right now there's a problem with the FCC registry because 2 of those 5 counties filed their paperwork last year, and I am having a heck of a time getting in touch with the people in the FCC that are managing that. So I have followed up 3 times, and I will follow up some more. So because I know who those are and where that link is broken, I could help with that too.
That would be helpful. And if we are going to set a goal as the task force to have state, border to border text to 911 by May of 2021, maybe we should have just as a suggestion, maybe we should have a motion and a vote to make that a goal of the task force, so that when we talk to these agencies, we can tell them this is an official policy of the task force, that we are going to try to do this.
Does that goal include only native? They're doing it themselves. It also include arrangements like Kimberly had with people.
I would say that including arrangements, because it really doesn't matter whether they're taking it themselves or whether their neighbors are taking it. We want the customer or the user to be able to reach 911 if they text 911 anywhere in the state.
Yep, provide that service regardless of how it looks. Yeah.
Motion should reflect that.
Agreed.
Okay, well, I'm all for it. Can I get a motion for, what do we want to call this, like a resolution, or?
Sorry, this is Mandy. I hate to jump in, but before the motion is made, I agree that it would be a fantastic thing to achieve text to 911 available throughout the entire state of Colorado. In fact, my PSAP is taking text for another PSAP who it's fiscally unreasonable for them to bring it into their center. However, I guess, and this is where I'll just need some help, but I just feel like maybe it's the task force overstepping on PSAP's ability to make their own decisions, especially since we don't have a statewide governance that requires it.
Well, this is Daryl. I would make it clear, the task force does not have the authority to require PSAPs to do this. But if we tell them that the task force has set a goal for itself to accomplish this, maybe that will help move them in that direction. If a PSAP absolutely refuses to take text to 911, there's really not anything we can do about that. But I don't think that's the case. I think it's more a matter of not knowing how to move forward or being afraid to reach out to one of the neighbors to help them do it.
Yep.
Well, the base level texting services are no longer free, right?
Right.
So I wonder how much of that is an obstacle as well.
Yeah. I absolutely think that's part of it, because it was a lot less cost prohibitive back in the day than it is anymore, for sure.
Do we resolve that issue if we're having one authority that already takes messages, relay them?
Yes, there wouldn't be a cost to the PSAP at that point. The PSAP that doesn't have it, because they're not using any of their technology to answer the text calls.
And to me, therein lies the solution to Mandy's point. We're offering them an opportunity to provide cost-free to their authority and to their citizens the very necessary tool of texting to 911. So really, that takes that argument out of the equation. I understand, Mandy, you're right. The task force doesn't have any authority over them, but the citizens and travelers to our state deserve to have that accessibility. This is an accessibility issue more than anything else. So there is not a good argument against it, governments or otherwise.
Where text messages are being relayed, is there still a cost to the ones receiving? Do they have to get a broadband service that isn't available? Is it a telephone call relaying the message? How? I don't know the mechanics of how it, but do they impose costs nevertheless on the receiving PSAP, the NPSAP?
No, there's not. So from a phone connection perspective, however they want the information relayed back and forth, that was just something that was identified as call in on this number. So there wasn't additional phone lines. From our end, as it relates to configurations, we needed their routing, their ESNs, the routing information. They needed to provide us map layers. And then we had all the documentation we needed to supply to the carriers, but it's more soft costs, not any hard costs, because we already had the integration in our Viper.
When we're talking about having regional PSAPs, do it on a regional basis, is that getting the map layers and the personnel, is that something that is more onerous than maybe we're assuming?
That's why Kimberly is a great point to tell you what's involved. I mean, she's already done it. They've already done it in Larimer, so.
Well, that's my question, is what she's done Larimer, is that something that, for example, somebody out on the western slope for the Northwest would be able to replicate? Or is that, if they only have 2 dispatchers, is that something they couldn't do?
Yeah, so Joe, it's really, there's a couple layers to the process, and as it relates to getting it set up, those layers relate to having letters for the carrier. So it's something that if the agency is willing to take on text to 911 for another agency, there is some work that's required on preparing letters and sending those letters to the carrier. Obviously, an IGA just talking about the relationship between the two, but again, it's an agency wouldn't want to say, hey, I can take text 911 without doing some of this foundational work. But it's not difficult, and I have all the documents saved, and I'm sure Mandy probably does too from her doing that for another agency right now, that we can easily replicate and change names and go from there. So I don't see any barriers with that.
And as far as really started for us, it was very easy, the stuff we had to provide. And I mean, she probably had more work on her end than, us benefiting from it had on our end.
And that was my question, was moving on to on Kimberly's end, if we're having more than just one authority, one PSAP or authority take the text messages and relay them. It looks like we have 2 jurisdictions in the Northwest and 13 in the East that, and I don't know, is Pueblo County or Pueblo City the one that doesn't have it? May not matter. That would be a lot for one authority, I would think, to handle. Do you think, Kimberly?
Not really. I mean, it's one, you could do one request adding all of those routing information in one big map layer. So not really. And in some other states, they do the same thing where they handle it by region. I want to say one state does it for the entire state. So it's really not difficult. We can definitely figure this out.
What kind of load does it put on your personnel?
Almost none.
Yeah.
So I'm sorry, Joe, what was the question?
What kind of load does that put on your staff? Are they reading emails, relaying by phone the information of PSAPs, or are they just forwarding text messages?
Yeah, the text to 911 comes in integrated in the Viper. So just like a voice call rings in for the Viper solution, I'm not sure what the Vesta looks like, but there's also standalone, but it actually rings in like a voice call. It's a text screen. So when they're relaying that information to the other agency, they're relaying it in voice. So they're calling them up saying, there's a call at this address, this is what the caller is saying, etc. So they take the text call, then they phone the other agency and pass on that information. And then what we were doing is we were pulling monthly reports and sending those over to Garfield and Mesa County.
So if you were relaying to 15 or 16 other counties, rural counties, do you think that you would be able to handle, or are the text messages low enough volume, even, for example, if there are tornadoes ravaging the Eastern Plains, that you could handle that?
So from a text volume, it is incredibly low from a number perspective of how many text calls are coming in. And I have no idea what to even expect from the population out in that area. But and I'm not setting up saying, hey, we want to do this for the whole state. We're willing to do whatever it takes to make this happen. But as it relates to volume, it doesn't require additional bodies to take these type of text calls. It's not a lot, not even probably one a month in some of these areas.
Okay, yeah, my question is going to, if we're going to ask somebody who was like in the Eastern Plains area to pick up some of them, what, if they're a rural authority, PSAP as well, which has maybe 2 positions, 2 dispatchers on duty, would that be something they could handle? Is it something you could handle because you have a number of PSAPs and more staff?
Yeah, I think it's absolutely something they could handle. Washington, Yuma took it for that entire region.
And generally speaking, you know, so like Joe, what Kimberly said earlier, she gets about 80 text 911 calls, and that's among all 5 of her PSAPs over the course of a month. And you know how big Larimer County is with CSU there. So think about some of these smaller counties with, you know, less than 10,000 people in them. You're probably talking about, you could almost count on 2 hands how many text calls they get a month. But when they get them, they need to go somewhere. And that's what's not happening now.
Okay, well, I just wanted to flesh out the issues to make sure that what we were proposing was in fact reasonable.
So Kimberly, this is Jackie. I just had one quick question about the map layer, because some of these counties I see that are highlighted don't have a map at all, although they are having their towers routed to their center, obviously. So would the tower routing be sufficient, or do you need an actual GIS layer?
So we actually had the GIS layer, not just the tower. So we needed to know their ESN boundaries. So even if they don't have a map, Intrado has ESN boundaries that they create. And so even if the local PSAP doesn't have everything in a map and a boundary, Intrado uses maps and boundaries. So there's other ways to obtain that, but it's an ESN map layer that would allow us to then know what that routing is for that jurisdiction.
Awesome, thank you.
Yep. And I stole the GIS, one of the GIS programmers from Intrado. He's part of my team. So I get all sorts of awesome inside scoop on some of that stuff.
Nice.
That's awesome.
I know.
Okay, so back to what we were talking about before. Do we want to do some sort of resolution or something saying that this is our goal for next year, for the next year? I think personally, I think it's valuable, and it's part of our mission is to advance 911 in the state. and it's not going to be like we're telling people what to do. We're just talking about what our goal is and what we're going to try to do to accomplish it.
Hey, Kimberly, this is Jennifer Kirkland.
Go ahead.
I think we should have a resolution like that, and I think that outreach and having that goal, you know, it doesn't have to be telling people that they have to. This is the state of Colorado's goal. How can we help you reach it? And there's more than one way to skin that cat, pardon my expression, and I'd be in favor of a resolution.
Okay. Mandy, do you still have some concerns, or? Or would you be?
Sorry, I was having a hard time getting unmuted there for a second. No, I think we just need to be very careful with the wording of our motion. I think, like I said, I'm a big supporter of text to 911 throughout the entire state. I mean, so much that my PSAP posts for another PSAP, and like Kimberly, we're willing to do that because I can attest that we just don't get that many of them. However, I just also want to respect the fact that, you know, how we're governed here in Colorado, and each PSAP's authority to govern and make their own operational and administrative decisions.
Okay, so
Vicki,
Kimberly
this
just
is-
sent wording about 911 task force has established a goal for text to 911 services throughout Colorado for May 2021 with no, you know, orders or anything like that, any kind of language like that. Jess, did you have something?
Yeah, Vicki, I was just thinking that one of the things we might want to do as a work product in conjunction with this would be to articulate us, you know, the simple reasons why it's recommended by the task force, and who the audience is for text 911, and what minimal burden it seems to place on the ECCs when implemented, and just have that as a 1 or 2 page document that the, you know, if a director at an authority is wanting to get some funding for it, they have that in their quiver to present to the powers that be.
And I think we already have that from the Resource Center because we've done all our outreach. When we were doing the road shows, that was some of the stuff that we were actually talking about.
Yep. Thank you, Vicki. I was just gonna reiterate exactly what you said. We already have those tools. So
there's a resolution format where it starts, you know, whereas text messaging is important to get 911 calls from you know, people with disabilities and that sort of thing, and you could kind of layer that in, and then now therefore we make this resolution. There isn't really time to put in that format, I think, to vote on it today, but we could vote on the resolution, and then with instructions that, you know, it will include the reasons, you know, for it as the preface to the resolution.
Okay, well, so Kimberly suggested this, and this is what I was kind of going to suggest too, is that we'll start working on this now, have a resolution drafted for our next meeting, and we can work out that language. We can be very sensitive to kind of the issues that Mandy was speaking to. I think it's all about delivery. I do. So Kimberly, since you said we could start the work now, does that mean that you're volunteering to help us write up some language for that?
Yeah, so I would be happy to ask Tracy, who's actually on the call, to work out a resolution and draft a resolution for the board the task force to consider. I emailed over the IGA draft or final IGA, but I kept it in a Word document that we used with Mesa and Garfield County, and I sent that over to Monica and Daryl. So I think a lot of that foundational work Monica's going to take, but Monica, just let me know what you need as you have those conversations. And then that resolution will be for the next meeting.
Absolutely. And I think at the next meeting, it'll be nice to have that along with an update on those counties that I was able to get in touch with.
Terrific.
And then, having an official resolution from the task force will be nice, because that'll get filed in the miscellaneous proceeding that the commissioners see. So it will be something that the commissioners will know that the task force is working on this, and that it has set an actual deadline goal for themselves to achieve it. So I like the idea of putting it in a formal resolution.
I agree. Awesome. Very good discussion, guys. This is This is important. Anything else on the text to 911? Okay, next up we've got the CenturyLink Annual 911 Contingency Plan Filing Review.
Okay, great. This is Tim. So, as I had mentioned earlier when I was jumping the gun, that we had filed this on April 30th after getting some feedback from you all on a couple of different things. And one of the things that we did, so I just wanted to highlight a couple of things. As I said before, I don't necessarily have some of the technical answers on some of these things, but I did want to just highlight a few things for you. So we have gone through, because we have now begun implementing the EZNet, we wanted to break out EZNet versus E911 items, just so that as we're going forward and transitioning, and once we transition ultimately away from E911, we can kind of follow through the things that are going to fall off and the things that are going to stay on. So a few spots I've just tried to put in parentheses after some of the items, whether or not it's an E911 only or an EZNet only. So I have identified some of those kinds of things. Like interconnection points and things like that with other carriers hasn't changed. We're going to continue to use the selective routers for those purposes even after we transition to the EZNet, as we've described in the past. One of the things that we did find, we found a couple of errors in the demarcation points. I missed a couple of things. I even went back to look to see if I saved the wrong version or sent in the wrong version, but had a couple of errors. So what I'd like is for folks to go through, and if they see anything that's incorrect or they have some questions about, to get in touch with me. I'd like to file a corrected version of this around the end of the month. So maybe in the next couple few weeks, give folks a time to look it over. One of the main highlights that has changed is on contingency routing, specifically for conditions 1, 2, and 3. So as you'll see in the submission, we still have those in there, but now we've labeled those as E911. And if you go, and then we still have the diagrams, but if you then go past condition 3, we now have for the EZNet, the abandonment routing guide. And so that's a few pages long, and it's got a couple of different connections. So whether it's SIP or not, there's a couple of different pages for those. There aren't too many real differences, but there are some. So I just wanted to highlight that was something that is new, that had never been in the plan before. And the condition 4 will remain the same, whether it was E911 or NG911, because we're just talking about call routing. So some of that remains the same regardless of whether or not you've transitioned or not. And then of course the contact information and the contingency plan phone numbers is in here as well. So a couple of new things, and I just wanted to highlight that for you all, so that you could, as you're looking through this, making sure you're understanding that there's some E911 and some EZNet throughout this. And with that, I will stop there. See if anybody's got any questions.
Hey, Tim, this is the redacted version, so this part is all blacked out here, but when I was looking at the unredacted version, it looked like there were a lot of customer refused items in this part of the contingency plan. Was that more than usual, or were those, is customer refused really the right term, or is it more that they weren't applicable?
I think it's pretty been about the same amount, and it's that they never responded to Lisa Sheridan to confirm the information that we have on record. So while we have the information in our PSAP profiles, this particular document that's at the end here that Lisa compiles is just for her records of who was getting back to her.
So just because it says customer refused on here does not necessarily mean you don't have the information?
That is correct.
Okay.
Other C in there, Darrell?
What?
Term you would prefer to see, such as no PSAP response or something like that?
Well,
I mean, they're not actually
I would rather
refusing.
filled in with the proper information, but if people aren't responding, I don't know what CenturyLink can do. Now, it does seem like it's a little confusing if CenturyLink has the information in another format, but they just don't have it in this spreadsheet. I'm wondering if there's a way to fill it in from the other information they have.
I thought you were getting at, we asked the question, is customer refused? Sounds like customers said go to hell, and if they just didn't respond, that's a totally different kind of tone.
Well, perhaps, but it is only in the confidential document, which is only available to internally at the PUC or anybody who wants to sign an NDA with CenturyLink. I'm more concerned about the fact that I just want to make sure that CenturyLink has the numbers they need for the alternate routing when that alternate routing becomes necessary. And I don't, the document as it exists now, even in the confidential version, the unredacted version, it makes it look like there are huge holes in the information that CenturyLink needs to do alternate routing when it becomes necessary.
That it's not updated annually?
I guess that's a question for Tim. Tim, you said that some of those numbers might be in your databases. They're just not making it into the spreadsheet for this report. Is there a way to fill in this spreadsheet for this report from the numbers that you already have in your database?
Yeah, we probably could. I have always thought that this was sort of a weird thing, and how it comes back to me, and then what we've provided to the commission, because we do have. I mean, there may be one out there that has never given us a phone number at all, but I doubt it. This is just to update and make sure that our records are accurate. And so that's what that document shows. So it really is different than what are all the numbers for all of you.
I guess, a related question is, why are the PSAPs or 911 authorities not responding to your requests? I don't know how we answer that question other than to reach out to each of them separately. So maybe I'll take the unredacted version and make some spot checks with some of the 911 authorities where it shows customer refused and ask if they received the request from you guys and whether or not they responded, and if they didn't, why not?
Would it help to have a column that had the date last updated or confirmed?
Yeah, I think that's a good idea.
So this is Kimberly. I have a question about condition 4 in the EZNet environment.
Okay.
So I'm a bit confused, and this goes back to our conversations about EZNet and just how in the EZNet environment and just the new tariff, new rules, that CenturyLink's responsibility is really from the selective router to the demarcation instead of the central office to the selective router to the PSAP demarcation. So from a condition 4 perspective, if we're talking about just an EZNet environment, does this slide exactly on 9 here represent the EZNet condition 4 scenario?
There's no difference between for condition 4 for the EZNet or E911.
Okay.
I guess for either the EZNet or Legacy 911, if you've got a condition 4, it's not getting to CenturyLink's core 911 network. So it just has to be rerouted to a local PSAP. Am I describing that right, Tim?
Yes, generally, yes, that's correct.
I just thought that through our conversations on it, as it relates to what is regulated and required, or the work that would be done by CenturyLink, it was really the rerouting at that CO for condition 4 was more
I'm seeing the pictures. Oh, the alarm at 1400. This was like a meeting at 2 and I need to like list these notes for it. Are you kidding?
Sorry, just the background. I was trying to talk over that, but I thought it was shrinking your profile a little bit, and then anything that was a condition for landline reroute that was really being done on behalf of your customers, not so much required responsibility as it relates to what's under the rules that you have to do as the BESP.
I'm not sure if I understand the question in there.
Okay, so maybe what I can do, because I know it's already 1 o'clock, maybe I can just send an email, and then if there's an opportunity for more discussion about it, maybe we can put it on the agenda for our next meeting, because I do think condition 4, we just went through a condition 4. We had an outage up in one of our small communities, and we were on a condition 4 for a little while. So it's really critical that we understand it. If it does change or any of the responsibilities change in the EZNet or even under how the new rules are drafted, it would be good for us to understand that and talk through it. So I can just follow up, Tim, with you offline if that works.
Sure. You bet.
Okay.
And if there are some additional questions around the conditions 1, 2, 3 under the EZNet, I can get some folks to talk more specifically about that. I can bring some Intrado folks over.
That would be great. Okay.
Thank you, Tim.
Thank you, Tim. Okay, we are up to open discussion. Do we have any items for open discussion?
Just a quick item. It didn't get on the agenda because it's a new committee and I forgot to put it on the agenda, but that's the GIS committee. I'll let you know we have not met yet. I did put out the call for members and quite a few people responded, but a lot of the people who would be participating in that are also very busy helping with tracking coronavirus outbreak locations and things like that. GIS community is a big part of that response. So we have not met yet. We'll probably be meeting in June. Right. We'll see how busy they are in June and decide at that time whether we're ready to meet yet.
And Daryl, this is Jeff.
Yes, Jeff.
We had a meeting with GIS folks within our service area. I can't remember if it was last week or the week before, and there was great interest in that committee and joining it from those folks. I also attended a training, 2-day virtual training by GIS Colorado this week, and there's a lot of talk about NG911 and support for that. So I would highly encourage people to look at GIS Colorado and see what's going on there. FYI.
Thank you. And if anybody has any other personnel who have not joined the committee yet who would like to, we're looking for as much GIS expertise as possible. You don't have to be a GIS expert to be on the committee, but the committee is not going to be able to get its work done without that expertise. So send them my way, and I will put them to work once we finally get enough oxygen to do it.
Daryl, did I tell you that Kim McAndrews wants to be on that committee from South Metro?
The name does not sound familiar, so if you would send me an email, I would appreciate it.
I will.
Great. Any other items for open discussion? Okay, can I get a motion to adjourn?
Carl, make that motion.
Thanks, Carl. And a second?
Tina, seconds.
Thanks, Tina.
Before you take the vote, Vicki, before you take that vote, when do you want to reconvene for the Resource Center board meeting?
Okay. How much time do you guys want? Like 10 minutes?
I'd like a 10-minute break, please.
We get 2.
Okay. Okay, so we will be reconvening the Resource Center board meeting at 1:20. Do I have anybody opposed to concluding the PUC task force meeting? All right. Thank you, everyone. We'll have the Resource Center board meeting here in 10 minutes.
For you.
Thanks, everybody.
I'll send out the link to everybody. It's different than this one.
Thanks.